everybody. Welcome to our annual election period event. We're so excited to have you joining us here at Magellan Healthcare. I'm Kim Sixkiller, president, and today we're going to go over all of the things that you need to know for this year's annual election period. We have a great lineup of speakers for you today that are going to pour into you the knowledge that you need to have a successful event. So getting started today, let's talk about housekeeping and ways that you can make this event as successful as possible for you. First and foremost, you have a chat below. Feel free to put any questions that you have come up throughout the day in that chat. We will be keeping track of those, and at the end of the day, there is going to be a live panel that you're going to have the opportunity to ask your questions, and we're going to rehash the questions that you've already sent in to us. Don't worry if you miss something. This is being recorded, and because you signed up, you are going to get a copy of it after the presentation. Additionally, you have the link to get a copy of all of our resources. Those will also not go anywhere afterwards. You're going to have access to those, as well as if you are an agent with Magellan Healthcare, you have access to our portal, partnerwithmhc.com, where you can log in and you're going to find some additional things just for you. We're very excited to know that there's agents who are with us, with other marketing organizations, and people thinking about getting into the business here with us today. We're going to give everyone some stuff that they can take away so that everyone feels like they had something that helped them grow. Without further ado, we kind of want to jump into the first thing, which is AEP and certifications. Obviously, all of you know you can't do anything if you don't have your licenses and the things in place that you need to make sure that you have taken care of your needs for CMS, otherwise known as the Center of Medicare and Medicaid. Our first speaker today is Jen Vandevelde. She is the Director of Business Development for Magellan Healthcare. She's been in the healthcare industry for over 2 decades, and she's been working in the Medicare industry for over the last 5 years. We're so excited to have her, and we are blessed to have her knowledge at the table. Give us a warm welcome for Jen.
Hi, I'm Jen Vandevelde, Director of Business Development for Magellan Healthcare, and I'm here to talk to you today about the exciting topic of AEP and certifications. So as many of you are aware, the AEP opened June 21st, so just a few days ago, and is ready to be taken. And we wanted to give you some tips and tricks to make sure that your AEP experience is as easy as possible. A lot of people are a little intimidated by the AEP because it is an hours-long test. Right? And so we like to make sure that our agents are aware it's an open book test unless you are using it for continuing education credits. So if you are taking an open book test, use your resources. Don't be afraid. There are sites like Quizlet, Red Blue Card, there are tons of them where you can get the information that you need to help you through that test. The other thing to remember, and this is a big one, just get it done. Don't put it off. The longer you put it off, the bigger it feels. The longer it takes you to complete it, the more it feels like an insurmountable task. If you pop in, get that AEP done and out of the way, you'll be set and ready to go to do your certs, and you'll be prepared for AEP. The third thing to remember is that we have a discount link for you. There is a QR code that you can scan in your resource guide that will give you a discount link where you can take the AEP for $125 instead of $175. It doesn't actually show a discount when you go to check out. It just changes the price for you, so don't worry about it. Once you've done your AEP, you're then ready for your certs. And certs are kind of like AEP in that you don't want to put those off. You want to get them done as quickly as you can. And as many of you are likely already aware, the certifications for carriers can range anywhere from simply taking the AEP to specific education that you see for each provider or for each carrier. So jump in, get those done, know which ones you need to do, keep track of them, and knock them out of the way. Much like the AEP, on your carrier certs, use your resources. Many of those certifications will have downloads that you can use, so they'll actually download the presentation or download resources for you to help you finish those certifications. If you have any trouble with your AEP or your certifications, if you're a Magellan Health agent, just give us a call. We're happy to help. There's no reason that you shouldn't pass either the AEP or your certifications. That's what we're here for. So don't be afraid, again, to use your resources. We're one of those resources. So I'll say it one more time. Just knock them out, get them out of the way. The AHIP's already open. The carrier certifications will be open anywhere between June 21st and the end of June. So you can knock your AHIP out, get your certifications done, and then you can focus on what you really need to focus on during AEP, which is doing the right thing for your clients and getting those commissions. And that's what we're all here for. With that, I'll turn it back over to Kim.
Thanks, Jen. Everybody, as she said, get on there, take your AHIP. We have that link for you. The QR code's available. If you have questions or any trouble, don't hesitate to give us a call. Our number is on the screen and the downloads below. Next, we want to talk to you guys about carrier specifics. So we are so lucky to have Aetna here with us today. We have Matt Ware and Becky Ware, based out of Kansas City, Missouri. They're going to talk to you a little bit about what you can expect from Aetna and during the Medicare Advantage period. So without further ado, welcome.
You guys are on?
Hey, Kim, thanks for the introduction and having Aetna here today. Happy to be here. So my name is Jason Ware. I'm the broker manager for the Heartland Market Individual Medicare Advantage and PDP. I'm one of 4 broker managers here. So the Heartland Market consists of Western Missouri and all of Kansas. And my submarkets I oversee are the Kansas City Metro, Northwest Missouri up to the Iowa border, and Eastern Kansas out through Emporia. And I have Becky Ware here with me today, who's our local broker support representative that's dedicated to locally to all of our agents throughout the Heartland market. And I'm going to get into our certifications for this year, and then I'll kick it over to Becky to talk to you about finding your ready to sell status and some more information on Producer World. So Aetna certification go live date is next Wednesday, June 28th. We'll be taking the website down Monday and Tuesday so we can load information for 2024. And how you get to our certification website, the link is aetna.cmpsystem.com, or there's a link through your Producer World account, or all you have to do is just enter Aetna Medicare Cert in your Google search bar, and it'll take you right to the website. So, like I said, go live is Wednesday, June 28th. If you haven't certified with us before and you're a new agent coming on, wait until the 28th to do your certifications, because that will duly qualify you for your 2023 and 2024 certifications. If you go in today or this weekend to do your 2023 certifications, you're going to have to redo them once 2024 opens. So in 2023, we introduced 2 certification options, and we're carrying that over to 2024. So you have option 1 is AHIP, and that's discounted to $125 if you take it through Aetna. Option 2 is our homegrown AHIP alternative, and that's free of charge if you take that option. So once you go to our website and go to the main landing page, on the left-hand side of the website is login for users who have used our website before. And if you're a new user, you go through the new registration process on the right side of the screen. Once you log in from the main page, scroll all the way down to the bottom under My Certifications, and you'll click on the 2024 certification link, and that'll take you to the main certification page. And then at the top is either the AHIP option or the Aetna alternative. And this year, you only have to do either AHIP or our alternative option. Please don't do both, because last year we had 84% of our agents took both modules, and that slowed down their training big time. So also new this year, enhanced course design. We've combined our Medicare Advantage and DSNP courses into one single course. And then our Aetna PDP course, we now made a lot more user-friendly and shorter. And then to check your status on where you're at on certifications, if you at the top of your cert page, if you click on Aetna, it'll take you back to the main page. And if you scroll all the way down under My Certifications, there's a status bar. So you're not done until that says 100%. So that's how you recheck that. And then on your ready to sell status, is checked through Producer World, and I'm going to toss it over to Becky to discuss that.
Thanks, Jason. Hi, I'm Becky Ware. Like Jason said, I am the market associate dedicated to the Heartland market. There is a market associate in every market. So even if you're not in Heartland, you do have a market associate available to you. If you don't know who that is, you can reach out to your broker manager and they can provide that information to you. Or you can reach out to myself. I believe Kim is sending out our contact information. So if you want to reach out to me, you can as well, and I can provide you with who that is in your area. Market associates are really dedicated and passionate about supporting the brokers in our market. As a market associate, we can answer any questions that you have about enrollments. If you have an app issue, you can reach out to your market associate for that. Another thing that we assist with is ready to sell. So if you have questions about certifications, if you have questions about contracting, if you have a license that you need to update with Aetna Medicare, you can do all that through your market associate. Another thing that comes up a lot especially during AEP, it does come up all year, but especially during AEP when you're signing up your members for those new plans, is provider inquiry, because we want to make sure that the providers that the members are using are still in network for the plans. So if you have a provider that you're not sure about network status, or if you just aren't sure if the information that you're seeing is correct, you can always reach out to your market associate and we can confirm that information if they're in or out of network for you. The last thing I'll bring up today, there's a plethora of other stuff that the market associates can do for you, but I won't take all the time up today. The last thing I'll bring up today is Producer World. There's a couple of things that I wanted to spotlight on here for you, just because they will be really beneficial for your AEP and certification season. The first thing is when you go into Producer World, you'll click on Individual Medicare on that top menu bar. It'll bring you to the Individual Medicare homepage. In the middle of that page is a purple quick links bar. If you click on that drop down, one of the first things you're going to see is this 2023 at the moment certifications link. As of next Wednesday, as Jason mentioned, it'll be 2024. That'll take you straight over to the certification page. You can log in, you can register, you can go ahead and get all those certs done. If you have any issues logging in, you forgot your password since it's been a year since we had to do this, or if you're a new user and you're having issues getting registered, or even if you're in a module and it's stuck, it won't advance, whatever the issue is, you can reach out to your market associate and we can help you get that ball rolling for you. The second thing I wanted to bring up is, as Jason mentioned, checking your ready to sell status in Producer World. We used to send ready to sell emails. We stopped doing that last year. So if you finish your certifications, you're waiting for that ready to sell email, it's never going to come, but you can always go to Producer World and check your ready to sell map tool. On that quick links bar, it is the very last one. It's at the very bottom, it says verify your ready to sell status. You click on that and it'll bring you up your map. It's the color coded representation of what your ready to sell status is for Aetna Medicare. If you're ready to sell for MAPD and PDP, it'll be a light purple. PDP or just PDP will be a little bit darker purple, and so on and so on. And also, if you hover your mouse over the state, it'll show you exactly what date you're ready to sell for that product. So MAPD, you were ready to sell this date. PDP, you're ready to sell this date. Of course, if you're not ready to sell, there won't be a date there. If you get on your map and you're not seeing the information correctly, or you think something's missing, reach out to your market associate. I'm going to say it all day.
Or broker manager.
Or broker manager, of course. It's a team. We're a team. Also, I wanted to make sure to mention that there will be 2 tabs for the rest of 2023 since there is the dual certification. So if you are wanting to verify your ready to sell status for AEP, make sure that you are clicked on the 2024 map so that you are seeing the correct information for AEP since those are 2024 plans. There'll be 2 tabs up in the left corner. The last thing I wanted to talk about today is just accessing your reports. So on that drop down bar on the quick links, the third one from the bottom, so 2 up from your ready to sell map, is going to be your reports link. If you click on that, it'll bring you straight to your reports menu. There are 3 member driven reports on here that I wanted to highlight today. The first one of those is your member application search. This one's really beneficial if there's only one member's information that you're looking for. You can come in here, you can search by MBI, you can search by member number. If you have the application tracking number, you can use that. You can also use just their name. And this will pull up the member's demographic information, so name, date of birth, address, phone number, anything like that. It also shows you plan details, so what plan they're on, the effective date, what if there's a termination date, what that is, all that kind of stuff. Also, if you do receive your commissions directly through Aetna and not through your upline, there will be a commissions tab with the last 6 months of commission information for that member as well. While I'm talking about commissions, I will mention that if you do get paid directly by Aetna, you can reach out to your market associate if you have any commission questions. If you're paid by your upline, you would go to them. There are a couple of commission reports on Producer World. I won't go into them in detail, but there is the detail report and the summary report. They're monthly reports that you can generate for the last 6 months of your commission information. The last 2 reports I'm going to mention today are, first of all, the pending application report. This is any application that you've submitted that has not completed the enrollment process. It'll show you members' demographic information, the plan that's pending, and the reason why it's pending. So it could be awaiting CMS reply, or a duplicate application, or we could have requested more information from you or from the member. So if you ever get into your pending app report, you're not sure why something's pending, you see that reason, but it doesn't make sense, you're wondering how you can get that process rolling, you can reach out to your market associate and we can assist with that. The other one is your Medicare book of business. This is going to show you, of course, any active membership that you have on for Aetna Medicare, MAPD, and PDP. It'll also show you any membership that's terminated in the last 12 months. And both the pending app report and the Medicare book of business pull in a crystal reports format, which is good for visualization of your book of business, but not necessarily for maneuvering within the data. So my strong recommendation is if you did want to get in there and manipulate the data, you're going to want to export it into a Microsoft Excel document. You can click on the export button. It's right next to the print button. It's kind of like a box with an arrow pointing out of it. And then it's going to bring up the export box. You'll use Microsoft Excel workbook data only. And once you click that, it'll pull over to an Excel document. You can change the font, you can sort, you can filter, you can drill down to just specific members on a plan, specific members in a zip code, any members who are terminating, anything like that. So it's much easier to manipulate your data. And that is all I had for today.
Yeah, thanks for having us. And another reminder, CERT's open next Wednesday, June 28th. Only do one of the options, AHIP or our AHIP alternative. And if you do AHIP and transition over their website, and when you transmit the score and come back to our website, it's supposed to lock out that other option this year. So we shouldn't have, double the work again. Thanks again for having us, and
have a successful AEP.
Certain AEP.
Thanks, Jason and Becky. Obviously, we just proved this is a live event because I had the first bobble of the day. I'm also okay with that because you know what? Things happen, guys. So one of the things that we want to talk to you about today is don't let analysis paralysis get to you. You're going to always worry about if you know enough or what if your clients have questions that you don't know how to answer, and you can't let that stop you. Remember, you probably already know about at least 50% more about the Medicare field than your clients know. So if they have a question that you're really not sure how to answer, just tell them, that's a great question. I want to confirm with my resources. Let me get back to you on that. Or if you have a resource like us for an independent marketing organization that you can call, give them a call as your expert and get them on the phone to help you with that client. One of the other things that we really like to make sure that you understand is that these things that you're hearing today are going to be available to you to get with the presenters one-on-one if needed, or with your group. So if any of these presenters are ones that you want to speak to more in depth, please make sure that you use their contact information that we're going to publish for you after the event. All right, our next presenter is Matt Gaines. Maybe I should call you Jason to be fair, but he is with Advanced Diabetes Supply. Before I really get him up here, I kind of want to explain to you guys why we feel passionate about including them and partnering with them. For ADS, what we have found is that it is a service to your client that complements what you're doing and it makes your service stickier. What I mean by that is that as you're helping your client, any of the extra values that you add is going to help to keep them as a client throughout the years when everyone else is calling and sending them cards and sending them emails. And also they're going to know that you're there to help them with more than just a sale. So for example, when I am meeting with any of my clients, I have a pre-form that they fill out. On that form, the question asks, have you been diagnosed or are you currently being treated for type 1 or type 2 diabetes? They say yes or no. If they say yes, I automatically know that part of my presentation and conversation with them as we're enrolling them in either a Medicare Advantage or prescription drug plan is to let them know that I partner with a service and they're going to receive a phone call to help them with their products and what they might need. This service is absolutely free to the client, also absolutely free to me. So it is helping me partner, add an additional benefit to the client, and they go back and they talk about this service. I have dozens of clients who have found this service very, very useful. And I don't want to steal any more of his thunder. So without further ado, I want to introduce Matt with ADS.
Hello, everyone. Thank you for tuning in, and thank you to Magellan for giving me the opportunity to speak today. I'm with Advanced Diabetes Supply, which is a diabetic specialized pharmacy. My name is Matthew Gaines, and I'm an account executive in our agent support program, which is a personalized retention service for you, Medicare agents, and your clients with diabetes. Our goal is to help you with retention and to keep that book of business you work so hard to build as we back you up and take care of those clients and all of their diabetic supplies. So thank you. I'm going to go ahead and get into our slides here. So it's a personalized retention service. This is another touch point for your clients. We make the call on your behalf, mentioning your name at the beginning of every call so that your client knows that their agent is the one that set them up for this plan. It's probably available to about a third of your clients that currently already book with you or prospects that you are speaking to for the future. It costs you and your client nothing. It's my favorite part about it. What is ADS? We are a diabetic supply pharmacy. We work directly with Medicare agents. We are a Medicare accredited pharmacy as well. We deliver everything straight to the home, whether it's standard diabetic supplies, DME, or anything that they need to help manage their diabetes. We've been supporting diabetic clients for over 20 years and been in the Medicare industry as well for about 13 or 14 years. So we really understand the process of making sure how these products and supplies get billed to the plan properly, as that tends to be one of the biggest problems we see clients face today, is making sure that they get everything they need and they're paying the amount they should pay or not having to pay anything additional out of pocket when it's not necessary. I'm an account executive for our agent support program. I specialize in Medicare Advantage and Medicare plans. So if you have any questions or information, feel free to reach out to me. I'd be happy to answer anything about any insurance plan specifically as far as I can. We provide agents with sales and retention support. So not only are we helping you retain those clients that you've already gotten, but it's giving you a great feature to add into your sales pitch for any clients or prospects that are diabetic. You can bring it up from the get-go and let them know that you have a service that's going to completely take care of them and make sure they don't have to waste any more time in their local pharmacy fighting for coverage they know they have. This is a little map here that shows you just the scope of how diabetes is spread across the country. You see a lot of those areas in there are very dense. About 1 in every 3 Medicare beneficiaries has diabetes or pre-diabetes, all the way up to about 48.8%, about 50%, including everybody that has pre-diabetes. So if they test their sugar at any time throughout the day, definitely that is someone that you can start letting them know about our service and forward them to us as well. These are some very common drugs that you see your clients on. If you want to try and locate any of your clients that have diabetes, you don't have the exact answer. Any of these drugs, if you see them on, it is likely they are diabetic or pre-diabetic and testing their sugar as well. And that is definitely something that there's definitely someone that we would be able to assist. We can provide this retention support to about a third of your book of business, as I mentioned. Diabetes is a growing problem within the country, so definitely there's a lot of people that we could be able to support. It costs you absolutely nothing. So it's just another value add to your pitch to help you land those clients that you're looking for. We handle all different types of supplies at ADS. The next few slides will kind of go in depth a little bit about what supplies we offer and how we take care of those. These are going to be your standard blood glucose monitors and testing supplies. So when a client uses these, pricking their finger, it's going to include a blood glucose meter, test strips, lancets, lancing device, and control solution. This is all billed to their Part B plan of their Medicare plan, whether it's Medicare Advantage or original Medicare plans. And this is going to be kind of the standard as far as diabetic supplies and blood testing goes. Next, we have continuous glucose monitors. These are becoming ever more popular on the market. There's a lot of people asking for them, and they just really increase the quality of life for anybody managing their diabetes. So no more pricking the finger. It's a sensor that goes on their body that continuously reads their glucose levels throughout the day, and they can check it as many times as they want simply by touching their reader against the sensor and seeing what their blood glucose levels are. As of today, there are some newer ones on the market. The Libre 3 is not yet covered by Medicare, so the Libre 2 is still very popular and a great device. We're hoping to see maybe some changes soon, but we can definitely keep you updated with any questions you have about that. The new Dexcom G7 is covered by Medicare and currently available for any of your clients that qualify. These are some of the standard insulin pumps that you'll see on the market. These also bill to Part B. We work with Medtronic and Tandem pumps, and then we can continuously supply their infusion sets and reservoirs and cartridges as well. Here's some of your Part D items. So these are going to be very common for people that are on insulin. You get alcohol wipes, their insulin syringes, and pen needles. We try and take care of your clients as much as possible so they have to pay as little out of pocket at their local pharmacy as possible. You'll also see the Omnipod -5 on here. That is a disposable insulin delivery device. It's great that this is a Part D item that makes it very easy for clients to get. All you need is a prescription from your doctor and we'll be able to supply that with you. There's no prior authorizations or any other extra requirements to qualify. So how can you take advantage? Reach out to me. If you reach out to me, I'd be happy to get you set up and get you ready for your first referral to send clients over to us. You can scan the QR code on the screen, or you can send me a text message at the 760 number on the screen as well. We need to get you into the system, so feel free to reach out to me as soon as possible so we're ready when you refer your first client to us. What'll happen once you do refer your first client? We'll call them on your behalf, referencing your name directly. So for example, we'll give your client a call. Hi, Mrs. Jones. Al Pacino, your insurance agent, asked us to give you a call to get you set up with home delivery of your diabetes testing supplies. This happens on every call, even if we're following up with one of your clients, so they know you are the one that set them up for this, and we want to make you look as good as possible. So we'll make sure to do that every time, but it also ensures your client that our service is safe, it's recommended, and it's not another scam call that they're receiving throughout the day. One other thing I usually recommend in your sales pitch or when you're letting your client know about our service that we're going to reach out to them, see the 760 number on the screen, have them preemptively save that in their phone. So when we call, they know it's ADS and they know to be expecting our call and that it's a safe one to answer as well, because I, as I'm sure any other agent would recommend not to answer any random phone calls throughout the day because I'm sure they get plenty of them. We'll obtain a prescription or prior authorization if it's required for the supplies that they need. We'll reach out to their doctor, fax the prescription request. Once we get that back, we'll verify their coverage details, let the client know if there's any copays and how we can support them moving forward and get their confirmation on the supplies that they need. And then we'll ship directly to their door and give them a call in advance of their refill date to let them know when they're eligible for their refill to make sure there's no lapse in the supplies that they receive. I can also set you up with no-cost marketing flyers So you can hand your clients as take-home items to remind them of the service that they're going to receive, or to give us a call if they have any questions, and of course some additional details of the supplies that they get and the service that we offer. Again, here's my contact information. If you have any questions, feel free to reach out. I'll be more than happy to get you set up with ADS so that you're ready to refer your first client over to us. My cell number is going to be the one highlighted in yellow. You can call or text that anytime. And then the text-only number is set up for after we connect and get you into the system. You can text and that'll go directly into my computer and let me know so I don't miss any contact from any of you. You can also email me. This QR code on the screen here will take you to an secured and encrypted link where you can fill out your client's information, and that'll port directly into our system, so there's nothing missed and super safe to make sure all of your client's information is going to be totally safe. Thank you again. I really appreciate the time today, and I hope to be hearing from you all soon.
Okay, Kim, you're on.
Thanks, everybody. Matt, that was great information. We're very excited to have these partners here for you guys today. One of the things that we want to take a little time to talk about to you guys about now is the actual IMO, or the independent marketing organization that you partner with. A lot of you are already partnered with great organizations. There's a lot of them out there. We all work together in this industry, or we all should work together in this industry to help each other. And if you haven't picked one yet, I want to talk to you a second about why you want to actually interview that marketing organization. Too many times I have heard agents say that they did not take the time to really research their organization or what they need, and instead they jumped in and figured they would figure that out later. Unfortunately, there are times that the organizations can decide that they're not ready to part ways if you are ready to move on. And so I want you to have 5 tips that will help you with how to decide what organizations are going to be right for you. The first one is easy. Interview your organization. You are an asset. You are a partner. You have just as much right to ask what's coming to the table as they're trying to get you to the table. So ask them what they specialize in. Also, ask them what they think they can improve in the most. Some organizations do great things with lead generation, and some organizations do great things with the marketing dollars that they spend. You will need different things as you're in different stages of your career. The second thing is ask them what services they're going to cover for you at no expense. And what I mean by services are things like the systems that you're going to need to do your job. For example, here at Magellan, we make sure that all of our agents have access to their quote systems, their enrollment systems, and their training systems free of charge. We want to make sure that you have access to that, so we cover that for you. There are other organizations who do, and there are other organizations who maybe they have spent more in the robust side of things, so they choose to charge for those services. There is no right or wrong answer. You just have to figure out what fits for you. The third thing is the availability and access to staff when you need it. If they're your partners, obviously at times you're going to need help with things. How can you get a hold of that marketer or that representative in their office when you need them? Yes, I fully believe that you should be jumping in and learning your carrier contacts. I will say it a dozen times. Your broker manager is your greatest asset when it comes to carrier information. But that doesn't mean that it should completely replace your sales partner at your marketing organization. So find out who's your contact going to be and how are you going to be able to get a hold of them when you need them. For example, the annual election period. We all know it is not Monday through Friday, 8 to 5. If there's an emergency, if something comes up, how does that work? I'm not going to tell you that I'm available 24 hours a day. I'm not going to pretend, and my agents would tell you that I don't answer every single email within 5 minutes, but I'm definitely always available. It just may take a little bit of time for me to get back to you. My agents have access to my cell number, and if they text me on the weekend, they know it could take a few hours. I also might answer and tell them, hey, I'm at my daughter's game. I'll get back to you with that shortly. If that's not what you need, great. But if it is what you need, then find a partner who's willing to do that for you. The next tip that I think is really important is What access do you have to the marketing materials that you're going to need? Again, you've heard our carrier and one of our vendors mentioned today that they have some great things that you can go in, print off at no charge. But what things can you use that'll help set your business aside from others in the industry? For example, you will see in the downloads that we show you, Magellan makes sure to help you personalize all of your sales tools at no cost to you. We truly believe that we are one of the best partnerships out there, and that is because we are true partners. We are not going to charge you for those services, and we know we're not the only ones out there, but that's how we do things differently. When you're getting involved with your marketing organization, the last thing that I really want to make sure that you're checking is your transparency. If you are looking to set up an independent business where you are the one who's going to be running it, you should be getting set up direct to the carrier for your commission. And what I mean by that is your commissions in most cases should come from the carrier and not be funneled through your marketing organization. The reason for that in most cases is you want to make sure that you own your business. We firmly believe that you are out there doing that hard work. You are doing this as an entrepreneur to build your business. You should own it. If you do not own your business, if the business routes through your upline and they pay you, what that can mean is, should you choose to part ways, should you choose to do something different, the years of hard work that you've put in, that residual income may not follow you. I have seen that happen to so many people, and that sometimes can be referred to as golden handcuffs. Look, I know there's some people out there right now who aren't very happy I'm sharing these facts with you, but I also know that there are hundreds of us out there that want to see this industry continue to evolve, and we want to make sure that people are set up for success so that they can have the businesses and the independence that they are looking for. If you have other questions about how to interview your marketing organization or even just what to select, make sure you go out to our YouTube channel as well. We have a ton of videos out there with that, as well as if you go out to YouTube, I will plug, just Google those topics. There are tons of other experts in the field who have lots of videos. We firmly believe at Magellan, you can't do it all yourself. And so we've partnered with several monsters in the industry to help us, and we help them in return. All right, so as we're talking through how you're going to work with the annual election period, let's talk about a couple more tidbits that you can use to help make things easier for you. For the annual election period, you're really going to be focused on the Medicare Advantage plans and the prescription drug plans. Those are the plans that from October 15th to December 7th, your clients are going to be able to make the election to decide what plan they're invested in for 2024. What that also means is if you have a client who's on a Medicare Advantage plan, for example, who wants to go to a Medicare supplement, this is the time that they can go through their underwriting, simplified underwriting, to see if they can make that change. Obviously, nothing is black and white. There are instances with special election periods and other reasons why clients can make changes throughout the year. But know that this is the time when there are clients that you probably have set aside to address their needs. Something that I make sure that I talk to all my clients about when we're looking at the drug side of their benefits is that they understand that they can use drug savings plans, and they probably will have to at some point in time to help them with their costs. We all know that there's a push to kind of redo the entire process and overhaul the drug administration system with Medicare. But until that gets there, make sure that you're telling your client that in addition to looking at the drug plan that you put them in, if their medication is over X dollar amount, whatever you decide that you want that to be, that they can use systems where they can go in and look at drug savings programs and see if they can save themselves money. They can also always ask their pharmacist to run it both ways. I have never seen a pharmacist refuse to run it both ways. So if you run into that, I would just suggest that they take a peek at what other pharmacies might be available. Or in some cases, if the medications are just too expensive, make sure that you urge them to go back and have that conversation with their physician so that they can figure out what other options there may be. Look, the reality is sometimes there are no other options. Sometimes that is the medication that's needed. And then that's why they need a holistic planning advisor who can help them figure out what other parts of their retirement or their budget are they going to have to adjust to make this work? If you're a holistic agent, you're going to make sure that your client has access to all of the different products that may be available based on what they need. We truly believe that being a holistic Medicare agent means offering Medicare supplements, Medicare Advantage, prescription drug, the litany of all of the auxiliary products such as hospital indemnity, your dental, vision, and hearing, many more that I'm not listing, but also under 65 care, because you're going to run into a lot of clients that have their spouse who is not yet eligible for Medicare. I know Galen Hendricks says it best. She calls it the spouse in the house. She has that term copyrighted, but Galen is great with that. And so she is one that I will throw out there for you guys that can explain to you why taking care of the spouse in the house is so important. If you have questions on how to cross-sell, don't worry, we've got that coming up next for you, as well as, again, lots of resources available. When it comes down to it, here at Magellan, we find that if we pour into you and give you these different educational pieces, they will help you get better. And in turn, that is why you want to partner with us. This whole event is live today for free. You guys didn't pay anything. Our vendors are all here. They didn't pay anything. We're not here to try to make money off of that. We are here to help educate you all. And in turn, we all get better together. Our next presenter is not quite here yet. So you guys see us, she's getting mic'd up. It's going to take just a second. So what we're going to do is we're going to do a little bit of an ad hoc. I'm going to bring up one of our partners. His name is Toby. He is with Cody Askins Marketing.
I'm going to enter from the wrong side of the stage here too.
You totally broke the rules. I don't know how Trey's going to feel about that.
Yeah, and Trey's got to frame us both into this one camera right here. We've got our own special short person camera.
Yeah, we do. It's the short person camera, also the boss camera.
Yep.
As we're going today. So one of the things that we can talk about is we can kind of talk through these live events. You've been partnered with us for marketing for the last 2.5 years.
Yeah.
When agents decide that they are ready to maybe step up and do their first event or do their first training, what are some of the big tips that you would make sure that they're aware of?
The first thing you need to make sure you're aware of is finding a good partner so that you have all the pieces that maybe you haven't thought of. So the live streams, maybe an event starts to run a little fast and a little early. You need a partner that has the experience of doing all of those things so that they can make adjustments on the fly.
Awesome. Obviously, you might have guessed we're running a little. We had some carriers who last minute had to cancel, and we completely understand that things happen. So as we tell you to work on the fly with your clients, we work on the fly with you. So Toby, how long have you been in the marketing industry now?
In the insurance space, about 3.5 years. Overall in marketing for about 20.
Okay. And so during the annual election period, obviously, I'm a huge advocate. I tell all of our agents that I help to coach that you should be separating your clients into the annual election period reminder pile and the immediate pile that you can assist.
Yes.
With those letters that I suggest you set out to everybody. Age 64 and up,
yes,
that the annual election period is coming. What tips do you have about how to make that letter concise and stand out from other letters that are going to come in the mail?
So the trick to any letters that are coming in the mail is going to be just making sure that it captures your brand. If you don't have a brand, that's where you need to start. You need to have that voice. You need to make sure that comes through. Don't make it too busy. Give it a nice image. We call it a hero image. You want to have big imagery. And then what you can also do is make sure there's a good call to action so they know exactly how to get a hold of you.
Awesome. Obviously, we talk a lot about marketing. We train a lot about marketing. Everyone who calls always asks what kind of free leads they can get, which leads are great. But if you don't know how to work your leads, guys, you're never going to be as successful as you can be. So we know there's really, I say, 3 different kinds of leads. You have your face-to-face,
yes,
you have your snail mail or old school mail,
yep,
and then you have your digital leads, right? Which one would you say is the most popular these days with insurance agents?
The most popular these days on the Medicare side is definitely going to be digital. That it produces the most leads. But as you're going to hear from one of our speakers coming up, and also when I talk later, is the seminar marketing is a tried and true way to make sure you are building your business. I will never steer anyone away from doing seminar marketing, sending out mailers, because it hits every single time when you do it right.
Agreed. Obviously, we're not going to steer people away either, because most of our top agents, they are doing the seminars. Very few pockets of the country do I still get a lot of pushback about people saying they can't get people in the room. We do absolutely see people attending seminars. They are having great success. People want to get in the room. They want to get the information. So on those seminars, would you say that your agents are a lot of times coming for you asking for the help from soup to nuts with everything?
Soup to nuts. They want help with everything. They want help with what they should say in the seminar. They want help with the direct mail design. They want help with trying to set the people up to attend. They want to know who attended and how to get in touch with them later. They want to know all the things, and they want help with every aspect.
Perfect. So we have 4 seminars that we have here at Magellan Healthcare, 4 that have been built out, some that are just standard basic 101s, and some that actually come from a different angle, kind of the cross-sale angle from the get-go. If you have an agent who wants to personalize those seminars, do you have any suggestions? I'm a huge advocate of the QR code, especially with the CMS changes that are coming about appointment setting. Do you have any suggestions for them about how to make their QR code stand out more?
So honestly, most people still don't do a QR code. So just by having one, you are going to stand out just a little bit. But you can customize QR codes now to be pretty much any design you want. So if you want to stand out even more, don't go with a standard QR code. Do some type of special design. It can even be your logo or anything else. So there's a lot of different things you can do.
Perfect. And I bet that's something you guys can create.
I bet it is.
Awesome. Is there anything that you just want to kind of tell them about your AEP tips or anything before we're
I'm not going to give away anything right now, but we have had some questions come through for some of our previous speakers today. So I'm actually going to bring them up.
Awesome.
And we're going to go through just a few questions that we've had. First speaker I'm going to bring up Matt, not Jason, from ADS. We have several questions, and I'll kind of pass the mic back and forth here. I won't freak Trey out. So first question that we get is, your services offer a broad spectrum for all of your clients. The question that we have is, do agents need to educate them before they would get on a call with you, or can we just tell them that you'll be calling to educate them?
So we can handle the education part for you if that's what you're comfortable with. If you want to let them know a little bit as to what to expect with ADS, that is great as well. If you have any questions where you want to get your information packed up a little bit before you have meetings with clients or present it to clients, definitely feel free to reach out. But whatever you're comfortable with, we're comfortable with as well. Just let them know we'll be calling them and we'll take care of the rest.
Wonderful. So question number, you've been a popular guy here in the questions. What if, so going back to now, you've got agents that are your clients and then you've got their clients. So what if a delivery is scheduled and now they don't need the supplies?
So the client can always stock up on extra supplies. If they're eligible to get a refill, they can get that at any time. If they have additional supplies, they can hang on to it, or they can tell us to hold off on their shipment, and we can hold that until they're ready to let us know to send it out to them. Whenever they're ready, we'll go ahead and get it out.
Oh, that's great. And you're just going to keep rolling with you. If a client uses a different brand of testing supplies, how would they switch to you?
So we have many different brands of testing supplies, from One Touch to Embrace to Vario, a lot of different things that we can offer. So whatever brand they're looking for, it's possible we may be able to help them depending on what it is, but it really depends on their insurance plan as well, because some insurance companies, especially MAPD plans, will have a specific brand on formulary. If it's not on formulary, then we can go ahead and pursue a prior authorization to see if we can go ahead and get them coverage for the specific product they're needing. For example, if they have bad vision and they need a talking meter, that's typically not on formulary for a lot of insurance companies. So we can go ahead and submit a prior authorization, get the paperwork that we need from their doctors, send that to the insurance company, and do everything we can to make sure they get the coverage of the supplies they need.
I love that. That's great. So what I'm hearing is, if you need support on the ADS side, they know exactly what they're doing and they can help you. So that's awesome. I have one more question. I'm gonna bring up a previous speaker. I'm gonna bring up Jason. We had one big question for him, not Matt. So Matt, you're good to go. Appreciate you coming back on with us. Jason, I'm gonna scoot over this way. I'm gonna get into my short guy camera and make Trey frame me back up.
Yeah, thanks for having me back up.
So the biggest question that we had from the audience right now is, what do you feel that separates yourself in the marketplace from other carriers on the MAPD side?
For sure, our local support.
I'll let you hold this.
Okay. Yeah. So our local support. So my agents know I'm available 7 days a week, 24/7. If the Chiefs are on, now my response might be a little delayed, but yeah, definitely local support. I mean, I'm one of 4 broker managers. We have Becky Ware, local broker support in the market, Gail Meadows, who's our sales director. And then we also have in Wichita, Kansas City Metro, and Springfield, community outreach coordinators that work with our agents who want to sell D-SNP plans. So yeah, definitely our local support's unmatched.
Amazing. Well, thank you, Jason. Thanks
Yeah,
for coming back
sure.
up.
Thanks
I'll
for
let you
having me.
exit the wrong direction as well. Then we're gonna bring back up Kim. We now are getting back on track. We're gonna give our next speaker a chance to gather herself just for a moment. She's rushed in. But Kim, we're gonna turn it back over to you.
Yeah. Okay. Pretty
all yours.
exciting. All right. Hopefully you guys are seeing not only that you can move on your feet, but obviously things happen. So we want to make sure that we keep rolling. We're going to continue to have tidbits between the presenters all day today. But our next presenter is with United Healthcare, Danielle Phillips. She's going to give you some great information about United Healthcare, why you should use them. And then also, I'm sure she has some tidbits in there for you about how to make your AEP successful. So without further ado, welcome to Danielle.
Hello, good morning, Magellan and friends. So nice to be here with you today. Thank you, Kim, for putting on such a wonderful broadcast for all of your folks out there. It's a pleasure to be here with you. My name is Danielle Phillips. I'm a market sales manager with United Healthcare, clicker in hand. And I'm here to talk to you guys a little bit today about why United Healthcare, some of our differentiators that set us apart as a carrier on a national footprint, and also to talk to you a little bit about the tools and benefits and support that we offer in our local markets to be able to help you really grow your business plan and help you grow your Medicare Advantage business. So the first screen we're going to take a look at here are some major differentiators for United Healthcare. And it's really important to know, first of all, for all of you that are already contracted, you may know some of this information as you work with United across the nation. For any of you who are thinking about coming on board, United Healthcare is a wonderful partner that has something for everyone pretty much everywhere in the nation. So the first thing I want to point out is that United Healthcare really is the #1 Medicare Advantage insurer by enrollment. So CMS allowed us to make that plug, right? So we can't say anything that isn't true, but we do have 13 million lives that we serve that are Medicare beneficiaries, which is more than any other insurer, which lets you know that we really know healthcare, and we continually are growing and changing to meet the needs of our beneficiaries to continue to have more membership than ever and provide great benefits to access to healthcare out there. So the other thing that differentiates us is the AARP brand. We are the only company to offer Medicare plans with the AARP name. And so for our members, the AARP is where you go when you become a senior. And so to have that recognition and branding is very powerful and means a lot for trust and consistency for our beneficiaries. So we are also ranked #5 on the Fortune 500, making us the top 5 largest companies for healthcare or anywhere in the nation for that matter. So we're also recognized by Fortune as one of the world's most admired companies for the 12th consecutive year. So what that means to you as an agency partner, an agent partner, is that with United Healthcare, it's something that you can trust. You know that we're always working to do the best. We're highly conservative, so stability is one of our #1 goals, which is really important for you and your business, as well as bringing those benefits to your members. And lastly, on this slide, you'll see that we are ranked 13 on LinkedIn's top companies. This was a 2022 statistic. Obviously, we don't have the new rollouts for what we would say for 24, but as of last year coming into 23, we were ranked 13 with LinkedIn for the top companies seeking talent and growing career. And that includes our distribution channel as well. So here we're going to take a look at kind of how that footprint and all of the things that I just talked about as United Healthcare as an organization, kind of how that translates into what that means for you on the ground, taking our products out to the beneficiaries and what's available to them. So first of all, we are known as the product experts. And in that, it gives you the advantage to be able to take advantage of our national footprint. Our plans and our whole portfolio, which includes Medicare Advantage, Medicare Supplement, PDP, and our DSNP and CSNP plans, reach over 95% of all eligibles, which is more than any other carrier. So, and every year we're always expanding and growing as well. So hopefully someday we'll be able to bring our benefits to every nook and cranny across the nation. But as of right now, we do have the largest footprint and can touch the most lives. So that's really helpful for you, no matter where you're working, that you would be able to have stable plans to offer with the United Healthcare AARP name. So we also have the largest footprint in the dual special needs, partial and full plans and portfolio. So we reach over 3/4 of the eligibles as of right now. And of course, year over year, that will continue to grow as we can continue to invest in that special needs market to deliver the benefits that they need to meet them where they are with their social determinants of health. So the other thing that you can really see with us, which is unparalleled value with some of our competitors, is that we have the largest national network. And so oftentimes, even with a regional player, you'll see the word national network, but United Healthcare is a true national network, which gives members access to our lowest contracted rates and copays with over more than 1 million providers, and we're growing that regularly. So pretty much, those of you that have worked with United Healthcare know that our network is unmatched, whether you're dealing with a HMO or a PPO or a DSNP plan. So pretty exciting news there. And United Healthcare does offer our members exclusive access to benefits that basically we have taken on to master. So it's not necessarily contracted through a third party, but it is a United Healthcare specifically owned and invested benefit, and that are only available through United Healthcare. So those are things with our group partners such as Renew Active, our United Healthcare Dental, Vision, Hearing, and our United Healthcare Global, which is what helps us with some of those network things. And the last thing I'll talk about that really differentiates United Healthcare is that with all the things I just listed, that allows us to be able to have benefits that are better, beyond, and better than before. And year over year, we're hoping to continually grow that for you guys. And of course, which brings that to our beloved members, which is who we're really here to serve. So on this slide, you'll see a few key benefits that really drive value in all of our plans across the national footprint. And this will give you kind of the how to identify those differentiators when you're looking at a sales kit, either online or if you're using a paper kit. But the first one you can see there is the icon of the United States, which indicates our national network, which is going to be on all of our core plans. The next one shows you the $35 insulin. Don't forget on our CSNP plans, which vary from market to market, that will have that same kind of logo, but it's going to be for the $25 insulin, which is also something that's unique to United Healthcare. If you see the W in the blue circle, that's Walgreens preferred. So market specifically, we do have plans that have a special contract with Walgreens where they have preferred pharmacy pricing. Last year, we rolled out the Flex card on a lot of our plans. So where you see that blue square that says Flex, that's where we have the additional benefits above and beyond our ancillary allowances, where they can use that flexibly to add to whatever benefit they're wanting to get more of. On so many of our plans, we offer a 0 RX copay across the board. So if you see this little pill icon, that's what that refers to. And then of course in our D-SNP market, we have plans designated for our full dual eligibles and for our partial dual eligibles. And the blue full dot indicates full dual and the half blue dot indicates partial dual. So some easy things to look for and differentiators when you're looking to see what benefits are sticking out on the portfolio that you're looking at. So new enhancement this year. I know you guys are flooded with emails across the board, not just from us, but from all your carrier friends. But we did have an enhancement in certifications this year. As we know, it is that time to get ready for certification and to get ready to plow into our 2024 Super Bowl AEP, right? So one thing that we've done this year, and we're really excited to share with you, is United Healthcare opened certifications June 1st. United Healthcare does not require AHIP to complete your certification. Ours stands alone, and so you're able to do it even if you're not going to take AHIP. Some of you would have gotten an option for Fast Track this year. That's a pilot program for select agents who met certain production and compliance calculations that we rolled out to be able to have a fast track option. And those of you that got that, I would totally suggest that you do it. It's literally 38 questions. And once you're done, you're done. You have two options to pass it. At 85% or higher. If you don't, then of course you can go to our natural path of certification. If you do choose to do AHIP, that opened yesterday. You can transfer that over and it will happen as well. For those of you who just want to do the United Cert, not have to transfer AHIP or you haven't done AHIP yet, then you can take that separately and then transfer it on to your other carrier partners after you've completed United Healthcare. But you've gotten a lot of information through that via email, our Jarvis wrap that comes out to you guys, as well as it's out there on Jarvis. If you have any questions about that, you can reach out to your local market sales manager, which I'm going to give you a little bit more information about in this next slide. So enough about everything that United Healthcare has tried to do and is doing daily to make the best products, plans, benefits, stability for you and your members. Let's talk about you. You guys are 75 to 80% of our distribution channel. So without our broker partners, we would not be able to deliver the benefits to our members. So thank you for everything you do every day, because it all starts with you. And you are our members' primary enrollment channel. You're also the most influential person when it helps them to source for plan discovery and what is the best choice for them. So what United Healthcare has also done is strategically align market sales managers in each market to be able to be here and support you. So it's super important that you tap in to that person. So obviously you have amazing resources with your upline like Magellan and maybe different local things or trainings that we offer online and all of that. But you also have one of us. And the way that we're developed is however many brokers are contracted with United in your specific market, then there are a number of us to divide out to break you down to be able to be here with a segment of each of you as your number one contact. So if you don't know who that is, you could obviously reach out to Magellan. They can help you, or you'll have my contact information. I am here, locally in Kansas and Northwest Missouri, but I could certainly help you connect to who it is in your market that can help you build your business. So the reason it's so important that you know who your market sales manager is with United Healthcare is because our number one goal is to help you build your business. We want to help you take the United Healthcare portfolio and benefits and what the structure of your community and resources looks like to put those together so we can find out what your needs are, the market needs are, and then we can help you to build a business plan so that you could really turn your time and your resources into new membership and renewal commission for you guys, right? So there's a whole bunch of stuff that we look at. Number one is motivators, what the portfolio of products looks like in your market, what the different segments are in the footprint, and kind of what you're looking to do, what your time commitment is, what your goals are. And when we add all that up, we get a really successful business plan to help you, and then we can invest specifically in those strategies. So I know every carrier works a little bit differently on the investment side, But at United, we're really interested in helping you grow strategic sales pursuit strategies and investments that are going to help you actually turn that into business and long-lasting relationships. And through that, these are some of the areas that we look at. So retirement communities, senior expos, the VA, VFW, ethnic associations, places of worship, mobile home communities, golf and tennis clinics, Senior Olympics, senior centers, senior apartments, volunteering, any AARP senior groups. Of course, how do you build referrals? We work a lot with our providers and dental network. That's a great way to get you in the door with United to be able to generate some business. So this is what you and your market sales manager would actually sit down and discuss, and to help you really get into those relationships to be able to have ongoing business coming from it. The next thing, there we go. At United Healthcare, especially during AEP, we focus a lot on community meetings. And that's where we help you set up an opportunity to go in to local places in the community and host a meeting that's going to talk specifically about what United Healthcare is bringing to the community that year. And we help by investing in your location of that, your materials for that. We provide all of the slides and benefits. And typically, those have to be registered by July 31st. So if that's news to you or something that you're interested in, please make a note of that. And then, of course, reach out to me or Kim, or if you do know your local market sales manager. If not, we can get you in touch. We definitely want you to have access to be able to do these type of events that can really help you grow your United business. The other thing that we offer for you guys, which stands above most of our competitors, is our technology and tools. So we're going to take a look at a couple different things here. Pardon me, this has fun little animated slides. So the first thing that we offer is Jarvis. For every agent who is licensed, contracted, and appointed with United Healthcare, you have access to our online tools, which is called Jarvis. It's our own web page for you guys, essentially, and it's customized to kind of what you're licensed to sell. You can manage all of your certifications, your commissions through here, your applications. You have access to everything United. Not to mention, we have a full knowledge center, which offers multiple trainings. Not only do we have our live national trainings, your local market trainings, we also have web-based trainings that you can go through a whole content library and pick whatever topic you're interested in. What is Medicare, the different pieces, what is LIS, DSNP, veteran, and it's all there for you. We have live training, we have slideshow training, we have just about anything you could need out there. The next screen just shows you when you scroll down on that main page, this is also where we have all of our tools available as you're doing your daily business. So this is where our lean application system is held. That's where you process all your online applications. This is where we offer our Medicare, Medicaid eligibility verification lookup, which allows you to tell right away what plans your member may be eligible for outside of the MA portfolio. So that's DSNP and CSNP. We can have prescription drug lookup here, Rally, where you can find all of our providers. So everything you need is right here in one finger point. So on there is also our toolkit. Our toolkit is super, super, super valuable, guys. As you know, Medicare has serious compliance regulations on anything that you're sending out. So at United Healthcare, we offer hundreds of different types of already compliant, customizable mailers, flyers, magnets, postcards, you name it, where you can go out and create your own materials that are already CMS compliant to be able to market to your members, and you don't have to worry about anything other than putting in your personal information. All the ones that are downloadable are free. Obviously, if you'd like to print some of those come at a cost to have our printer send them to you, or you could just download them and then send them off to your own printer. Or another value add, you can work with your local market sales manager and we'll print them for you. No cost. So one really key factor to note about the toolkit is that we see about a triple productivity in agents who utilize the toolkit versus agents who don't. So at first it can seem a little overwhelming to learn a new system, and I recognize you have to do that for every carrier, but I'm telling you, get with somebody, get with me, get with whoever, and we will help you understand this so that you have access to all of the wonderful things we offer to you there that really, really do grow your business. The last slide here just talks about what you can and can't do for your members. This is something that has been asked and asked and asked for. That's another thing I'll tell you about United Healthcare that I can personally speak to. I was a broker for 10 years myself. So when I came to the carrier side, it was quite a different experience for me. And I learned a lot about what happens on this side that I hadn't necessarily understood before. And I didn't ever think that really our voices as agents came to the top of the carrier, right? Because we're dealing with the number 5 company in the world. Like, are they really listening to me sitting at the table? Well, what I can tell you firsthand is I learned at my first sales meeting last year when I came to United that it is true. For example, those of you that are familiar with our enrollment kits, you'll notice in the last 2 years, we added all of our vendor information on the back page. That was because an agent said, this is what we need to do. So when you guys bring that information to your market sales managers, we actually have the opportunity to sit down with our plan CEO every year at planning time and bring your wishes to the table that come from you, that come from the members. And this is another example of that. Agents wanted an easy handout that says, what can we do for our members? What can't we do for our members? So this is included in the slide here. And we did make some enhancements last year where you can actually log into your Jarvis. You can see all of your members' demographics, all of your book of business, all of that information. You can order new cards for them with a click. You don't even have to deal with PhD. You can change PCP and order a new card with a new doctor if you need to. And then the second half of the slides there are everything that you can do through PhD in customer service. And we recognize that maybe there are some hiccups there. So we also built in a PhD chat function, which has been super helpful. That way you're not having to call in. You can just chat right there from Jarvis, and in seconds you'll get your questions answered. So if you haven't used that function, I'd highly recommend it. Your guys' time is valuable. And we've seen a great improvement from the response from PhD and how our agents feel about it when they use that function. So that wraps up pretty much everything I had to share with you guys today. I will say it's not listed here, but I did include a PDF that you guys can download of our Medicare Made Clear. It is our super helpful, it kind of takes the big red, white, and blue book from Medicare, and it simplifies it down and makes it super easy for you to help do any presentations. Is it compliant for any presentation that you will do? They're free to download. They're free to order to your house. So I would suggest that you always have that. It's just really helpful for anyone in Medicare. And again, thanks for your partnership with United Healthcare. Thanks for having us today, and happy AEP coming soon.
Thank you, Danielle. We appreciate all that information. We are so lucky to have great carrier partners and be located near our broker managers to get their assistance whenever we need them. I know you keep hearing this, but like everyone said, make sure that you're looking to see who your broker managers are. All of the carriers have something on the website about them. If you're not really sure who it is, reach out to whoever your marketing organization is. They should definitely be able to tell you. And if not, you have our number. We're here to help. Okay, so now we're going to really go into how we're going to market and get the clients to make the money that you're here to make for the annual election period. So what we're going to do next is we're going to have a unique opportunity for you to hear from both one of the leading lead vendors in the industry and an agent who's been doing this for several years, and they have really created a secret sauce to not just getting the clients from the seminar into the appointment and sale, but also how to cross transition that into annuities and life insurance. So first, we're going to bring up Jen DeBure. She is with Leading Response. She has been pivotal for the organization and how to set up seminars face-to-face to ensure that you are maximizing the cost per acquisition and return of investment that you're seeing in your business. So welcome, Jen.
Thank you so much, Kim, for having me. Thank you. I'm grateful to be here. My name is Jen DeBure, and I am the Vice President of Sales with Leading Response. Leading Response, for those of you who may not know us, we have been in business for close to 30 years. We're generally credited as the people who created the Denner Seminar. That idea was really born with us in the financial industry. And we have been doing it in Medicare for many, many years, probably for something similar at the about same time. I have personally been with the organization for 20 years now. And in those 20 years, I have facilitated by myself somewhere between 40 and 50,000 seminar events. So I tell people all the time that there is a whole lot of things that I know nothing about. There's a lot of things that even in marketing that I know nothing about. But the one thing that I have a lot of expertise in is seminar marketing, what makes seminars successful, and how they work. So my hope today is to talk to you a little bit about the psychology behind seminars, some tips and tricks about seminars, what you need to know to make them successful for you, even if you're doing them on your own, some strategies that you can use just for seminars that you're doing all by yourself to make them more appealing, and what's working behind them. So I hope you get a few takeaways that whether or not you ever work with Leading Response, that you'll be able to use this to make seminars more successful for you. So let's start with a little bit of the history of seminar selling in Medicare. So when I first started with the company, we started doing, I believe Medicare Advantage comes into play somewhere in the time of 2004. And at that point in time, we started doing seminars with a lot of the major carriers, and we were doing them nationally. And AEP was our biggest time of year. And people were doing dinner seminars all over the country during AEP. They were so wildly successful that 2-3 years go down, and in those 2-3 years, CMS comes out and says no more dinners at seminars. And it changed the landscape of marketing in the Medicare industry. They eventually got to, you could have snacks at seminars. You could have a few snacks, make sure you don't have enough snacks that they equate a meal. But what happened is you would start seeing the carriers would put a list of, say, 20 different events that would be posted in newspapers. They would start doing these kind of at senior centers and cafeterias. Maybe they would have coffee, something like that. But seminars really changed, and those over the years became less and less effective. Quietly, a few years ago, CMS started allowing dinner seminars again, specifically for educational events, under a certain price range. All of a sudden, people get very interested in dinner seminars, and our business starts growing. We start growing it, and it is now our fastest growing industry at Leading Response, Medicare seminars, specifically educational events. So I want to talk to you a little bit about what I see currently when I go on, and when I'm building out this deck, I just went online and I looked at some seminar marketing materials that I could see that I could find online. If any of these are yours out there that are watching this video, I'm so sorry. I don't mean to insult you. Please forgive me. But these are just some ones that I found online. The first one you'll see comes from the Agency of Aging, and there is the Medicare card on that. Now, I don't know. Maybe the Agency of Aging is allowed to use the Medicare card. The rest of us are not. Don't do that. You'll see it on that slide. It says every Tuesday from 9 to 12. I don't know about you, but I don't want to spend 3 hours at the area of agency going to, or the Agency for Aging, going to a seminar event for 3 hours, 9 o'clock in the morning. The next two you see, they're in the middle of the day. One's a Tuesday, one's a Wednesday. They're at a senior living community. Again, if you're looking for a senior living community, you might be exploring senior living communities. But if that's not where you want to live, if that's not where you want your next home to be, that's probably not the most appealing venue for you. The final one is someone holding an event in the middle of their day, and that's at their office. Really, really convenient for the agent who put that on, not convenient for the people who are attending. So we flip that on their head. And we go, let's make it really appealing for people to go to seminars. Here's what we know about Medicare, is that every single person who onboards into Medicare is going to need help. It doesn't matter how educated they are. It doesn't matter how rich or wealthy they are. It doesn't matter their net worth. If they're not a Medicare agent themselves, they need someone to help guide them. So we'll go ahead and invite them to an educational event at a local restaurant. Now, our financial advisors, and anyone who may be also a financial advisor, knows that in the financial world, these are often held at places like Fleming's or Ruth Chris or some fancy high-end restaurant. In the Medicare world, they're not. These are held at Perkins, Golden Corrals, delis, pizza shops. We're not talking anything fancy. We are going to have them at 6 or 6:30 at night. And think about this, like how much, even if you're completely retired, you've got things going on throughout your day, but 6 or 6 o'clock at night, you're going to have dinner with your spouse if you're married, or dinner with your family. So we're going to make it at a very convenient time for them. You're of course going to pick up the tab, which they're going to appreciate. They're going to learn some good information, and it makes it convenient for them. It makes it a lot more fun. A dinner seminar is just a lot more fun, a lot more appealing than going 9 to 12 at the community center on a Tuesday morning, right? So 30 years ago, when our company founder was discovering how important seminars were and how incredible seminars worked, he did not realize, I believe at the time, that he was tapping into some very important psychological principles. I have a counterpart, our VP of sales in the financial side. His name is Jerry Linier. Jerry is a huge fan of Dr. Robert Cialdini. And Dr. Robert Cialdini's 6 principles of influence, we realize very closely correlate with the psychology behind seminar marketing. The very first one is the rule of reciprocity. So what the rule of reciprocity means is that if I do something nice for you, you naturally are going to want to do something nice for me. That's how that works. If I say to you, we're out having drinks, and I go, hey, this round's on me, you're going to naturally say, no problem, I got the next one. We're a group of friends, we're going out for dinner. I pick up the tab for the group of friends going out for dinner. One person in that group is going to say, I got it next time. This is how reciprocity works. Well, anyone who is at your seminar is feeling this same sense of reciprocity. And what they know, they've had a nice night out. They've had a lot of great information. You fed them dinner, they had a good time. And they know that the next step for them is to set up an appointment with you. The next rule, the principle of influence that I want to talk about is authority. So there is a huge, huge difference between standing in a room or standing in front of some video cameras and talking with authority about a product that you know about information that you have, versus calling on a lead that was sent to you digitally or over the phone or chasing down a direct mail lead and they don't know who you are. When you are the presenter speaking in front of 20 or 30 people, or in some cases more than 20 or 30 people, you now have a sense of authority. Hopefully, if you do a good job, maybe you crack a couple of bad jokes, you laugh a little bit. Sometimes things go terribly wrong, and that'll make you very, very likable, and the room will turn towards you. The fourth one is commitment and consistency. So you'll notice in the very beginning of my presentation, I talked about the fact that we have been in business for close to 30 years, that I have been with the company for 20 years, that I am committed to seminar marketing. There's commitment and consistency there. What your attendees want to know at your seminar is that you are going to be committed to them, that you're consistent, that you're there, that you're going to be there for them, to answer their questions, to take care of them as they go throughout the process. Fifth rule is scarcity. So a lot of times our events are so successful that we will have waiting lists. We'll have to have extra dates. The second someone lands on a waiting list, what happens to that person is fear of missing out. They are shocked. They go, oh my God, I can't even believe that I couldn't make it into this seminar on Medicare. You find some space that becomes available, you open up another date. Next thing you know, they want to go to the event because they couldn't get in. Now, we've all had a seminar where most of you have done them, where you went and you presented at a seminar and there was one couple walks in or there's 3 people total. And those feel really awkward, right? With our events, what we want to create is a bit of a party, a bit of a buzz, some excitement. And when you walk into a room and there's 20, 30, 40, 50 people there in that room with you, for all of us, what that creates is social proof. We walk in and we feel more comfortable. We feel that we made the right decision to go to this event, and that is proved because there are other people who made that decision with us. And we all feel that way when we walk into a room and there's other people there. So let's talk a little bit about some real life results. Not in abstract, but let's look at some actual numbers. This is one of our clients with Magellan that just did some events in, they were in Florida. And this was just a month or so ago. These are, at this point in the year, most of what we're doing is turning 65, Medicare 101. They had 56 total responders. 45 of those are people who RSVP'd for the event. This client was kind enough to actually show us back and give us back the information about who attended. So they had 22 attend their first one and 20 attend their second one. So the people who show up and raise their hand and say, hey, I want to go, they actually do, in fact, show up. And we see these kind of numbers all the time. These are actually pretty modest. I really want to be careful that I don't show you the astronomical numbers in every single slide and set unrealistic expectations. They vary. But this, we see all day, every day. One of our favorite events, now I want you to think about this as we go into AEP. This is something that we can do with educational events specifically. So there's only a period of time, as all the carriers know, that you can market sales events. But we can market educational events any time of year. So my absolute favorite time that I would recommend to you that you go in and do some educational events is what we call pre-AEP. In this case, it's kind of pre-AEP. Let's hit them right at the end of September. If we do that, if we do events right there at the end of September, you're going to get incredible results. People are starting to think about Medicare. They're going to show up in droves. And what they're going to do is they're going to attend your seminar. They're going to decide that they like you. They like the information that you gave to them. They feel very comfortable with you. And now they're going to intellectually take themselves out of the market. So once all the other noise in a couple of weeks starts heading their way about all the other things that they can go to and all the direct mail starts coming their way, they've already decided that you're their agent and they're going to work with you. And you will hopefully by this point in time have an appointment that's set with them that will be able to talk to them about actual plan details, benefits, and what plan is going to be right for them. We really like to do these most frequently, looking at the age demographics of, see, I think we have this tendency to forget about the turning 65s once we hit AEP, right? We do this 65 plus thing at AEP, and there's still all these turning 65s that are so valuable. So I recommend that the people that we market to are 64 and a half-ish to about 70. For most of my clients who are agents, what they tell me is that after age 70, most people kind of lock themselves in. Some of my agents will go up to maybe age 75, but at that point in time, people become less and less likely to change. So if you're thinking of your marketing budget and where you're going to implement it, I think this pre-AEP, this September time period is an excellent place to put some of your investment. Now, the next question that may come up is, well, what about AEP? Does it work during AEP? Sure does. So these are some actual live events, educational style events that we did last year during AEP, right smack dab in the middle. They were at 6 o'clock and 1 o'clock. This client, I'm going to tell you, I'm going to share you some more details about this particular client. But this client, I believe, that got these 200 reservations and responders to their event, used only direct mail, and I want to say this was about a 5,000 piece mailing, right smack dab in the middle of AEP. So let's talk a little bit about that, because I think there's this conversation that happens in your head that I hear, that I talk to agents about a lot, that says, well, why would I do educational events during AEP? I want to do sales events during AEP. I get it. I think there's value to both. I'm not going to tell you whether or not you should do sales events or educational events, but I'm going to show you some actual data in between the two. So here is some case studies from last year. Now, if you are an individual agent, you're going to see some really big numbers up on the screen. These are two large agencies that are essentially in the same market. So what happened last year is and these are two stories of two happy clients. As far as I know, both clients plan to do the exact same thing this year for AEP. Client number one, they want to do sales events. And the reason that they wanted to do sales events is because they were getting their sales events 100% paid by their carriers. They also wanted to be able to talk benefits, plan benefits, features, all of that, be able to sign people up right away. 30 campaigns. They sent out 92,000 invitations. Remember, this is a large agency. This is not one single agent. They have dozens of agents underneath them. They got a total of over 1,000 reservations. Most of those were direct mail. Some of those were Facebook advertising. They got a 1% response rate. For those of you who don't work in direct mail, 1% response rates are pretty solid. That's not bad. That's certainly not bad for a sales event in AEP. They spent $81,000 total dollars and their cost per lead was $80. Again, as far as I know, they were thrilled at the end of that. Client number two, they did 12 campaigns. They mailed out 60,000 invitations, 61,000 invitations. So they did what? 2/3 of the amount of mail as client number one. Then they got 1,754 total reservations. They only did direct mail. They did not do Facebook advertising. That was just their choice. They got a 3% response rate, triple the response rate. They spent $46,000. So they spent a little bit more than half of client number one. Their cost per lead was $26 plus the cost of the meals. They also had this mostly paid by carriers. As far as I know, client number two, their plans are to do exactly what they did last year, this year, but bigger. So you can think of those in both ways. Those are both two happy stories. Both of those clients are happy. The big difference is, of course, whether or not you're going to be able to talk specifically about a plan or whether you're going to talk educational and just broad education. There are some changes that came down the pipe this year as far as educational events go specifically. And I am not a lawyer, so please do not take legal advice from me. As a matter of fact, I recommend that you go up to your IMO, your FMO, your compliance expert. But as far as they go in regards to educational events, what we were told is that what I read in the guidelines is that at educational events moving forward after AEP this year, we will not be setting appointments at the events themselves. The spirit of this is that CMS doesn't want someone hovering over someone who goes to an educational event and hard pressuring them into setting an appointment. I am all for the consumer. I actually stand by this. I support this. You can still get, so you're not going to set appointments there. And this is specifically for educational, not for sales. You're not going to set appointments there, but you can still get permission to contact. And we're going to have all of the contact information for you. So what's the big deal? You set the appointment after the event. It's really a small, small change that happens. We have two different marketing channels that we primarily use when it comes to Medicare seminar marketing. I grew up in this industry in direct mail. I'm a big believer in direct mail. It's classic. Some people will call it old school. I'll call it classic, and it's classic for a reason because it still works. So when I'm talking to clients, I tell them that we really want to put most of our investment into direct mail, and then maybe we dabble a little bit in Facebook advertising on the side. The reason we're going to do that, Tanner's going to talk a little bit about the high intent, he told me today, the high intent of the people who come to his seminars. That high intent that we find, that getting you in front of the exact right person, that happens with direct mail. It's a little bit less likely when we come with Facebook advertising. Those people may not have quite the same level of intent as the people who join you from direct mail. So we'll put most of our money into direct mail, and then we'll put a little bit in Facebook advertising as much as you feel comfortable, totally optional, but we often use both of those channels. And we often use both of those channels all year long. When you work with us, Kim had told me that this was very, very important to her. When you work with us, we are very prescriptive in what it is that we're going to tell you to do. Your job is to be a Medicare agent. That's all. That your job is to know Medicare inside and out. My job is to know seminar marketing. My team's job is to know seminar marketing. We have, in the million seminars that we've done, made every mistake possible so that you don't have to. And so what we'll do is we'll go through a list and just tell you do this, 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 and this is going to work out great for you. When you go off brand and you go off channel and you're like, but Jen, I want to do it my way, that's when things often go astray. So we're going to try and do everything for you. We're going to set up the graphic design. We already have it. We have wonderful graphic artists. We have the content already developed. We've already sent the content through your uplines. We know that it's going to be compliant. We're going to do a bunch of onboarding and training with you from the very beginning that talks to you about what we have to do to set up the event for it to be a success from the beginning, where you want to host it, what time you want to do it, what the best practices are. We have a brochure that will be attached that they'll be sending out as part of this, where you go over the best practices and also contact information, and we'll walk you through all of it. We'll take all of the inbound reservations for you. People can register by phone or online. We can send out outbound email and text reminders to those people who choose to opt in. We get the list for you. We'll tell you exactly who the best people are the list are based on your market. We'll take care of all of that for you. We do all print, postage, and production. So we try and make this as easy and seamless for you as humanly possible and to set you up for success in every possible way. We have a brand new platform that we're bringing on board called Hub. Hub is an updated version of Prospect Connect, and what this is your event management portal. So you'll be able to see your reservations as they come in real time, get information on the people who are attending your event, find out when they're going to, what age they are, whether or not they're married, if they're bringing their spouse, who it is that they're attending with. If they have opted in to emails and text messages, those will get sent out automatically by the system, and you'll be able to print out event rosters, all of those things. All of that is handled for you, all at one price, all together, very simple. Some of the other solutions that we offer are on-demand webinars. I love on-demand webinars as kind of a background marketing. So for some of our clients, what they'll do is they'll pre-record a webinar much like this one. We'll do Facebook marketing in the back. And in addition to the seminars and everything else that they do, then we will have them, they can have these webinars going where we've done all of it, and appointments will just start popping into their calendar. Leads will just start popping in of people who have watched their webinar that they can follow up with. So this is an additional tool that you can have in your arsenal in addition to seminars. And we'll take care of everything for you for it. We'll just charge you a simple advertising fee. Many of our agents are looking to grow their own agencies, and they want to host recruiting events. We host recruiting events frequently. And then many of our agents are also involved in financial services. So that's where our company was born. And we do a lot in financial services seminars. So I'm not going to go into any detail about that, but if any of those things are of interest to you, then that's something that we can talk about. You would call your contact person. There's another Jen on the screen. Her name is Jen Nicholson. When I got here and I arrived yesterday and I started to get to meet all the wonderful people here at Magellan, every conversation started with, we work with Jen Nicholson and she's wonderful. Kim said that, Jen said that, Toby said that, Tanner said that. Jen Nicholson is the contact for Magellan, and she is a nationally, it's not too much for me to say that she is a nationally recognized expert in the field of seminar marketing and Medicare. So you are in the best of hands with her. Her contact information is here on the screen and will also be sent to you. So I think that's about it for me, and I believe we had some next steps. Thank you so much.
We were kind of waving her to stay on because there were several different questions that were asked. So we wanted to kind of ask you those questions. Toby's saying go that way just a little.
Go that
But
way.
yeah.
He was kind of waving to me in the camera too. I think I moved around too much for Toby a bit. He kept like, stop moving.
So the first thing is we had some agents that were asking kind of specific questions about the laws in their states. So do you have advice for them about the best way to make sure they're marketing properly for their state for these things? So for example, the things that you're talking about for marketing, they asked about California. Can they do it all in California?
We work in California all the time,
Mhm.
but there are specific disclosures that are going to be a little different state by state. So there's going to be disclosures that are a little bit different on the bottom. Again, I am not an attorney. Don't make me put your license. I don't want to be responsible for your license. What I want you to do is check that disclosure on the bottom. We're going to send you a proof that you're going to sign off on. Please send that to your upline.
Yes.
Have someone much smarter than me check them, make sure that all those disclosures are right on the bottom.
Absolutely, yes. And remember that when you're working with your contacts at Leading Response, they know those things. They know, okay, so they're in California. So when it gets created, they apply what they believe to be the appropriate.
Yep.
They do give that back to you. And I will tell you, Jen, for example, knows that at Magellan, the proper email to send it to so that we then comply it and tell our agents, yes, this is blessed, you're good. So if your upline isn't doing that with you, ask them, figure out who your compliance person is or who's responsible for that, because yeah, that's something that you never want to mess with. So
That's
I agree
right.
with you completely.
Double check it. Because the rules change frequently too, right? Like this year we have to add in new disclosures. Last year we had to add in some new disclosures. This year we have to add in some additional new disclosures. So just make sure you double check it and give us enough time to all do that.
Absolutely. The other question that people were asking was, are there any kind of discounts if they contact you guys? And should they tell you that they're contacting you through us, or how should they?
They should absolutely tell us that they're contacting us. Call and say, hey, Jen, I was watching the Magellan presentation and I would like to talk to Jen Nicholson about this program, and we'll make sure that we get your affiliate pricing for them.
Perfect. And then what we want to do, we thought was kind of unique. They were very excited when they got to talk a little is, as you guys know, next coming up, we have Tanner Moore. He is the president of Guardian Health Advisors based out of Chattanooga, Tennessee. He goes by Coach Medicare there in that area. He is going to speak to Medicare seminars, the return of investment, the cross sale, and how to really maximize those appointments that you're getting through your vendor. But because he does work with Leading Response exclusively for his mail, it's kind of a good opportunity for these two to get to talk about what they like best and what works. So we're going to bring Tanner up. Tanner, please join us. Yeah, you can just come right here.
Perfect.
And I'm going to step off.
Perfect.
I'm going to pass this to you because
Yeah.
you're going to need it now.
Thank you. I appreciate it. Hey, everyone. So really what we're going to talk about together is just how Leading Response and Guardian Health Advisors really partner together to make sure and ensure that we have a really, really good marketing system when it comes to our seminar marketing. And I know for me, we really have been working with y'all for right around 1.5 years now in this business. And really what I think a lot of people want to know is, how does Leading Response, especially like Jen Nicholson, work with the agency when it comes to seminar marketing, and how hard is it?
It's so easy for them. Jen is going to tell you, do this, do this, do this, do this, do this, do this. That's it.
And she is exactly right. And it is just like anything. Jen Nicholson is my rep. So I work with Jen directly. And just like you said in your last presentation, I loved what you said, because you said you all are the specialists and the experts in the seminar marketing system. And that is so true, y'all, because I'll tell you right now, I thought I had a great idea, and Jen said, I don't think it's going to work, but I'm going to let you try it, and it's on you. And I fell flat on my face. So definitely listen to Leading Response when they do it, because they know exactly what you need as the agent. So sometimes people have to learn their own way. That was me, and I learned, and I ate crow on that, and I told Jen that too. And so that's why I listen to her verbatim on everything now.
I think that happens a lot. I mean, people come to me a lot and they'll go, I have this great idea. And for you, it may have been the very first time that you've thought of that. For us, we've probably already done that idea 1,000 times. So we've got a lot of data behind it that will tell you, well, it may or may not work for you. I can't guarantee one way or another, but this is what we know is best practices. And I am personally, and I believe as an organization, I'm really risk adverse. I treat your money as if it were my money. And what I want to do is make sure that I'm doing the sure thing, right? I don't want to take chances. I don't want to take a lot of risks. I want to do the thing that's been proven and true for close to 30 years. And so we're going to walk you down that path, and we're going to go, this is best practices for you. And if you choose to veer off, then we understand.
Sure, and I'll let a little bit in on what I veered off on, and it really was the lunch seminar.
Oh.
And working at that 11:30 to 12:30 range, I felt like maybe I would get a better response with people that are already retired, that I know I would be able to close at a quicker amount of time than somebody that may be working. And Jen was amazing with saying, hey, that's a great idea. However, we see that the response rate is a little bit lower when it comes to that. So if you do mail X number of mailers, you may not get the response that you want. And that's exactly what happened when I went through that.
Tell me exactly what it was, because my guess is going to be, before you tell me, I'm going to tell you right now what he's going to tell me. It was half. Was it half?
It was less than half.
It was
less than half than what I normally get. And I'm going to go through the numbers of what I have. And we're going to do a deep dive into what I do case study wise. So you can see what my response rate is during my current night seminars. And you'll kind of be able to understand what my numbers were on the lunch as well.
I think when we're looking at, so throughout the year, when we talk about turning 65, so many of those people who are turning 65 are still working.
Yeah.
So lunches really shouldn't even be on the table. When we're not talking AEP, we're talking turning 65, let's only look at evenings. When we are talking AEP, you might have some people on the older side of the spectrum that would prefer a lunch, and you may have some that want to go to a dinner. Dinner is the more appealing event party time, right?
Sure.
It's when the couple comes together, even if they're busy throughout the day. So I think during AEP, you can do one lunch and one dinner. But think of this, like even then, we're mostly going to target people who are 64 and a half, not 65,
Right.
64 and a half to 70. How old is that? Like this is not, we're not talking about 90-year-olds who, you know, want to be home by 3, right? These are still people who are lively. They've got a whole lot left in them. They want to go out. Dinners at 6 is just normal.
Sure, absolutely. And I think maybe that lunch seminar is better suited for a webinar type of event, potentially. Those are the ones you may be able to get a little bit more reach on than maybe direct mail when it comes to lunch. What do you see on that?
I would say just whenever you're doing it, if you're going to do a lunch, have an anchor. If you ever want to do something that you want to try something out, then just have an anchor. And the anchor is going to be a dinner event at 6 or 6:30. Then whatever this secondary event is, doesn't really matter if it doesn't work. You still had this one and this one works. And you didn't put all your eggs in that basket.
Yeah, awesome.
So the one thing that breaks my heart though is when I get people who have really full rooms and then they don't close and it falls flat. And so I'm so glad that like the next presentation, I got really excited yesterday when I looked at the schedule, and the next presentation was like, now we're going to talk about how to take these from seminar attendees to appointments. And I was like, yes,
Yeah.
I love that, because that's what we need, right?
Right, absolutely.
We need that next step.
Sure.
So what happened with your first one and how did you find your system?
Yeah. So my first one and how I found my system was, and I'm going to go a little bit into this when I get going, but I've been in the industry now this is my 3rd year. So I'm a little past that 2-year mark of when I wrote my first policy. And I focused on a restaurant in town, in my hometown, that I actually knew the owner, and it was a senior-led. Everybody in the senior community knew this restaurant, right? So I thought that would be an amazing place to be able to go in. People already had a reputation with this restaurant. I would get a good response out of it. But the key with them is they closed at 6 o'clock. So I couldn't do the night seminars. So I did lunches. I tried to do late afternoons as well. And I got decent numbers with it. This restaurant has been around for over 30 years in our restaurant community and locally in Chattanooga, Tennessee. And I got good numbers and good attendance out of it. But it wasn't exactly what I wanted because it wasn't that night perspective. People may have still been working, so they couldn't get there to it. So I ended up pivoting and going to another restaurant. And from there on, my numbers have skyrocketed to where I want them to be. But the biggest thing that I want to talk about with Leading Response is you all bring such high intent clients and prospects into our seminars. And that goes from the customization of mailers that you can do.
Yeah.
It goes from the RSVP service if you decide to use that as a part of your event registration. So really it is a white label full service type of seminar marketing that I think our prospects already know, hey, listen, this is a high intent type of agent expert in this industry, and I'm going to go and learn about Medicare with that. So thank y'all for that.
It's that what I was talking about, the psychological principles of authority, right?
Sure.
We position you as an expert because you are.
Yeah.
You are an expert in Chattanooga on Medicare, and we're going to position you as that. And then they're going to come, and the messaging is so clear that we send out. We don't really believe in doing any sort of deceptive information that hiding anything. It's going to be, if it's a turning 65, it says happy birthday. And if it's a one-on-one, it says come learn more about Medicare one-on-one. And those will be what our topics will be for AEP as well. So thank you so much.
Jen, thank you so much. I really appreciate it. Yep. Perfect. Welcome everyone. Really what I thought this was a great segment and pivot to what my talk and my presentation is going to be on. First off, my name is Tanner Moore. I am the Senior Healthcare Advisor for Guardian Investment Advisors. We have an LLC also that we pivoted to that is Guardian Health Advisors. We are a full holistic retirement planning agency. We have over 40 years of experience when it comes to financial planning and the financial planning, managed money side, and also insurance planning. But really, the last 3 years, we've gotten into the healthcare industry, and that is what our president and CEO and owner of Guardian Investment Advisors, Gary Thurman, has brought me in to really be our Medicare expert. And what Gary saw in the industry, as he's been in the industry for almost 25 years, is that he was shopping out Medicare plans to his friends, maybe brokers that were in the community locally. And every so often, I would say about 50%, he would come back for his clients and they would say, you know what, Gary? They really didn't explain too much with Medicare, or they just put me into a one-size-fits-all plan. I feel like they didn't educate me on the Medicare process, and it seems like it's very, very complicated. And if you know Gary, you would understand he doesn't want to deal with that headache. He was like, I don't want to deal with learning about Medicare. I don't want to do anything when it comes to understanding that. Because if you have a financial firm, you also understand there is so much more to worry about when it comes to managing your financial industry firm versus the Medicare side. But they do go hand in hand so perfectly. And so what he did is he was able to a little bit recruit me and bring me in 3 years ago, really 2.5 years ago. This is my third year in the industry. And it really couldn't have been the best fit for me. That is really been a blessing for me and my family. I also go by the name Coach Medicare. Coach Medicare is just a term that I came up with because, number one, CMS won't let me be called the Medicare coach, right? So Coach Medicare works a little bit better because my past experience is in education. I was a high school teacher and coach for 8 years before I got into the industry. I taught high school math, and I also coached baseball, and more specifically fast pitch softball. That's where I was a head coach for over 5 years. And so really I have a passion for helping people and for educating. And if you're in the Medicare industry, you're out there and you're an agent, you know specifically that is what is needed right now in the Medicare space. Our Medicare beneficiaries, they need help. They need that education process. And we can provide that for them because they don't know where to go. They don't know the questions that need to be asked or the process. I need to do A, B, and C first before I can get to D and E. So really, they need our help more than ever right now, especially with all the targeting marketing and the targeting ads that are out there that are really trying to pull them one way or the other. So they really need our help from a holistic standpoint. And that's what I try to provide with seminar marketing. So I'm going to get going with what we're going to do when it comes to seminar ROI. This has really been something that agents have contacted Kim about, and I've talked a little bit on some of our Magellan trainings. If you're not a part of Magellan and you want to learn about some of these trainings, we've done these in the past. I've come in and talked about my seminar prospecting and how it works. And so really what Kim wanted me to do is to talk about the numbers now, really go into what it is with seminar marketing that makes it such a scalable investment for us. And so that's what I'm going to do today. So today we're really going to talk about the pros and cons of seminar marketing. What are the benefits and what may be the negatives when it comes to that? We're going to talk about making sure you understand your numbers. The hardest struggle for me getting started a few years ago was the business side of this industry, because we have to understand there is going to be expenses. There are going to be things that cost money. So making sure you understand what those expenses may be from the get-go maybe helps you take it to your agency owner or take it to somebody that is signing off on your expenses so they understand the long-term effects that this can be. Because if you don't do that and you're asking that person, hey, can you ad spend or expense for this? They may say, where in the world is this coming from? It may take too long, right? So come at it with a game plan, and that's what we're going to talk about how we do that. We're going to go a deep dive into our numbers as well. So what am I seeing with my numbers in Chattanooga, Tennessee with my seminar marketing? And then we're also going to talk about how can you accelerate that using your cross sales, because I truly fully believe that if you can cross sell when it comes to some of your Medicare plan, and especially on the Medicare Advantage side, what you're just going to do is you're going to exponentially grow your revenue at a quicker pace. And that's going to help you grow quicker than maybe long term if you just are doing Medicare supplements and Advantage plans with no cross selling. So what are the pros and cons? Well, let's just talk about the pros. The pros are this is a proven system, right? Jen just talked about this with Leading Response. Seminar marketing is a proven system, and it's one of the longest scalable and easiest scalable systems that is out there. And why is that? Well, it's a personal touch feel. And what we mean by that is you are in front of the prospect. We are in person, in a restaurant, in a library, if you're not doing a dinner event, right? And so they have that personal touch. You're meeting them face to face, just as like you were a brick and mortar and they were coming into your office. This is truly high intent leads. And what we mean by that is people are coming, they are spending time out of their evening to come and listen to you present. This is not a webinar, right? Very easy, and don't get me wrong, very easy for you to sign on to this AEP Readiness Training and sitting there, whether you're in your office or whether you're on your couch with your dog, right? Very easy for you to log in and watch this without any intent to take anything into account. Well, these people are taking time out of their day to come and listen to you. So these are high intent leads from the get-go when we're talking about seminars. It's really making it a fixed expense. So over time, I know when I'm working with Jen Nicholson and I'm ready to go with my next month seminars or in 2 months and I'm planning those out, I know almost to a dollar amount, depending on if I change my mailer numbers and so forth, I know almost to a dollar amount what I'm spending per month on that. So you really truly know the fixed expense of that. And that's huge when it comes to planning, planning out your seminars multiple months out. You also don't know how far your reach can go with this, right? You never know who is in the room. And Jen hit this specifically before I came in. With Medicare, what I've fallen in love with is you can help somebody with very, very little, or you can help somebody with a lot of assets. Really, you can do anything with somebody on both ends of the spectrum. Obviously, you financial advisors out there know it's really hard to do something that somebody is just drawing Social Security on. There's really not much we can help them with financially, whether it be an annuity or managed money, if all they have is Social Security assets. That's really hard to do. But with Medicare, we can help anybody. And so I've had people in the room that I know they've had very little, and I know I've had a $2 million or more asset client prospect in the same exact room. So really you can help a lot of different people and reach a lot of different people when it comes to that. And you also don't know what companies they may own, what their influence is in the community. And so those different things, if you can pivot yourself as the expert, could also scale your referrals by, the nth degree when it comes to that. It's a long-term play, persistency-wise, okay? I see my persistency as being very, very high, and I'm not meaning this to boast, but over 99% persistency when it comes to attaching my clients that have come to my seminars that are on my books still. And so many veteran agents out there understand that. This is a persistency play where you're going to keep these clients for life as long as you do right by them. Let's talk about the cons, though. What is it? It's expensive, right? If you're really talking about investing front loading your investment, it can get expensive. And so when you start to see the numbers, you may understand that. But I'm going to also show you how can we make that expense be paid off a little bit quicker, right? This is not the instant gratification society. We live in a world now that people want instant gratification. Sometimes social media ads provide that instant gratification when it comes to rewriting Medicare supplements or getting leads instantly. Let me call those leads and bombard them, and let me write a policy today or tomorrow, right? We're not in that industry when we're talking about seminar marketing, okay? This is a long-term play. Obviously, it's a long-term play when it talks about getting paid, right? This is not something I'm going to be able to get paid on tomorrow, right? Now, you may see an example where you can look into a financial client out of this, which we'll talk about, which helps you get paid a little quicker. But when we're talking about Medicare planning, you're not going to get paid quickly on this. We're going to talk about how that revenue comes in long-term in just a minute. There we go. Perfect. Sorry. The teacher in me can't work this, so I apologize with that. The first thing we're going to do is really go into understanding your numbers, okay? When we're understanding our numbers, here are the things that we have to talk about when it's talking about, okay, what are our expenses going to be? The first thing is what is your expense going to be? And that's going to be how much mailers are you going to be mailing out? How much is your food going to cost you? Do you have a location fee? I like to use restaurants that don't charge me a fee for the room, right? You can negotiate these things with the restaurants because believe me, restaurants are always looking to have business, right? If you can come into a restaurant and say, hey, listen, I'm going to provide 20 to 30 high intent people that are going to all order food because I'm paying the bill. Can I use this personal room that maybe has a TV? They're going to love that. Most places are not going to charge you a fee when it comes to that. I'm not saying all of them won't, right? But I try to find places that aren't going to charge a location fee on there. Also, if you're going to add some social media marketing expense, I know that some people love to supplement their direct mail with leading response with some social media marketing. That's a decision on your own, right? Are you going to be able to add spend to bring in more prospects on that? I will say this, though. I have done this myself, and I found that the leading response prospects are higher intent than my social media responders when they come in. So if you do that, just understand that may happen, okay? You may be able to have a show rate that's higher for your leading response direct mail prospects versus those social media signees. Think about how many attendees you want with that, okay? Typically, this is going to center on your response rate. What do you want out of your seminar? How many people do you want? And let's reverse engineer the back model to see how many mailers I maybe need to mail out. The last thing is fully understand how much and what you want to get paid on, okay? Think about this. You know that cross-selling is going to have a certain set of revenue if you're selling a cancer plan. If you put somebody on MAPD and they're turning 65, you know specifically what you're going to get paid on that. You also know how much the average med sup comp is going to be in your area, and that typically is going to vary depending on where you are and where you're writing this for the premium. So understand those to make sure that everything is going to go full circle. Next slide. So let's talk about a deep dive into our numbers, okay? These are my numbers, y'all. So if you ever want to talk about this, don't feverishly write this down, okay? I know as an agent, when I got on these trainings, I was trying to write everything down. I'm going to allow you to email afterwards to get all of these resources. So do not write these numbers down because it can be cumbersome. Just soak this in for a minute, okay? I'm going to send this resource out to everybody so you have it afterwards if you email in, and I'll give that offer at the end. So our deep dive is I average about 3,000 mail pieces per seminar. What I see on that is I do 2 nights of mailers. So I do a Tuesday night and Thursday night at a local restaurant. Sometimes I do 6 o'clock. Sometimes I do 6:30. I play around with those numbers just to play around with my numbers to see what works. Keep in mind that I've been doing this for a year and a half now. So I'm seeing some different things with my numbers. I was a math teacher in high school, so I love playing with numbers. And so I always want to see, and how can I tweak something to make it better? So I'm always deviating between that 6 and 6:30, but what I'm seeing is 6 o'clock is working better for me right now. I average about 30 attendees per mailer, okay? So if you do the math on that, that's about a 1% response rate. Jen hit the nail on the head and said direct mail is about that 1%. That's what I'm getting right now, okay? The dinners are included with this, and my average all-in cost right now is about $2,800, and that is all mailers, postage, and food, okay? We'll talk about in a little bit how can you leverage other people that can help with this expense as well. So if I'm looking at a 6-month cost, and the reason I'm doing a 6-month cost is it's going to take on average about 6 months before you start seeing revenue to come in to be about $16,800 for me specifically. That is not you, that is me. Your market may be different depending on some other factors, right? The reason I'm doing 6 months is I'm averaging mailing out 4 to 10 months out for turning 65 people. The reason I'm using 6 months is I'm seeing right now, on average, the people that are coming in and attending my seminars are 6 to 7 months out from turning 65. So why in the world do I want to use these numbers? Well, specifically because I know my first client and my first seminar isn't going to be turning 65 until 6 to 7 months after this seminar. So I know my revenue is not going to be coming in until 6 to 7 months after this seminar. So I really want to know and plan this long term to see how can I scale this and when is my first revenue coming in. So this is going to be my all-in expense before I'm starting to see revenue on that. Next slide. All right, here is the deep dive, okay? Let's take those 30 people that are coming to my seminars. I have in my offer and in my mail piece, somebody can bring a friend or bring a spouse, right? I'm averaging about half spouses and half friends when it comes to my 30. So I know for my high intent people turning 65, I'm getting exactly about 15 people that are turning 65 within that 4 to 10 month window at each of my seminar. Why do I want to know that? Because I know a conservative number, I can close 80% of those people. Now, some of those people may work. They may not be going on to Medicare specifically right when they turn 65, and that's okay. I know that I'm going to stay on top of them and I'm going to close them eventually. They're going to be my clients, okay? And I'm confident enough, and that's what's going to happen when I get them in person, because I'm the first touch person that they get with this, and I've provided the value for them when it comes to Medicare planning. So I know I'm going to close a 12 turning 65 clients, right? Let's do the math on this, okay? My market penetration in Chattanooga, Tennessee is about 50% med subs and 50% MAPDs, right? So what I'm going to do here is, if I truly take an educational approach to this and I truly do not have a motive or a bias on which side is best, right? If I just educate people alone, I can think long-term statistically, 50% are going to go on med subs, 50% are going to go on MAPDs. So I can plan this out that 6 med subs are going to be sold, 6 MAPDs are going to be sold. You do the math on this, right? My first seminar's revenue is going to be about $5,400 when it comes in, okay? You're going to see right above that number that $2,600 of that is going to be net revenue. That $2,600 is coming from $5,400 minus my seminar expense of $2,800, right? So I'm net revenue of $2,600, but next slide, please. You're going to see that that's not going to come in until the 7th month, really. So I really can't anticipate that kind of money coming in until my 7th month, because that is going to be how long it takes for getting the people turning 65, and I'm writing these plans to take for me to get that revenue in. So if we take that expense right there and we prolong it over and see how long it takes for me to pay back my initial investment at the top, $16,800, it's going to take about 6.5 more months for me to pay back that all-in investment. So really, hopefully by the end of year 1, if not a little bit longer than that, I'm going to be able to pay off that initial investment, okay? Here's what you have to do, y'all, okay? If you own your own agency, you're supplying your own expense, right? You can do these numbers and you have no problem writing the check and taking the expense, right? If you have an agency owner and you're the principal, you're not the one fronting this expense, right? You got to know these numbers, because when you're taking this to your agency owner and they're paying for 2 to 3 months of the expense and you haven't had any dimes, any money coming back in, believe me, okay, I've had this conversation with Gary before. They're going to be like, where in the world's our money coming from, right? I'm fronting this expense. Where is it coming from? So you have to take an approach of understanding the numbers, because I promise you, your boss or the agency owner is going to be able to look at numbers like this and see, okay, this is a long-term play. I understand what's going on here. Let's make sure we're doing this the right way when we're planning, okay? So that is a huge tip for somebody that may not be fronting this expense, and it may be coming from an agency owner, right? So how can we maximize our current ROI, right? How in the world can I make this a little bit quicker so I can see money coming in just a little bit quicker, okay? Well, what we can do is cross-sale. And really cross-selling here, next slide, please, is going to be cross-selling a hospital indemnity plan, a gap plan, a cancer plan, and maybe even a life insurance policy, more specifically an annuity. And we'll talk about that in just a minute too. So really the hospital indemnity and the cancer plan are really what I want to focus on when it comes to cross-selling here. And I only want to focus on the Medicare Advantage side of this. And so I'm going to go to the next slide here. Perfect. Thank you. And on the next slide, what I'm going to do is I'm going to think about my local plan, right? A hospital indemnity plus a cancer plan. And I'm going to think about what the additional revenue is. Now, you may be different, okay? I hope some carriers here don't get mad at me when I talk about this, right? But I'm averaging selling cancer plans with Aetna. They're a very, very competitive plan here in my market in Chattanooga, Tennessee. And my hospital indemnity plan is with Heartland National. They do a phenomenal job with a hospital indemnity plan. Why do I use those? They have competitive rates. I believe their application process is very simple and seamless for my clients. And they're very, very good about making sure they're following up if paperwork needs to be completed and also getting paid with that. So that's just kind of what I use. You may use something different. That's perfectly okay. But I'm averaging attaching a hospital indemnity plan and a cancer plan with all of my Medicare Advantage prospects. This is not even Medicare supplement, y'all. I'm just talking about the 6 people from my seminar that I'm attaching on a Medicare Advantage plan, right? That's $400 additional revenue for me per client. So per seminar, that's $2,400 additional revenue. Think about that right there. That's how you can supplement your expense and how you can scale this very, very quickly, okay? And it's not that hard to attach this. Some agents that have been on some calls with me in the past during our weekly Thursday trainings with K6, they know that I've been trying to really, really hit on this the last 6 months or so, and it has not been hard whatsoever. I assume the close from the beginning. And what I do is I say, so Mrs. Smith, we talked about your Medicare Advantage plan and we talked about what your biggest exposures are when it comes to a Medicare Advantage plan, more specifically your hospital expenses or like a critical illness. Would you say those are your highest expenses that you would see on this plan? Well, yeah, I do see that, Tanner. Okay, great. I'm going to talk about how we can close that and how we can really fill that gap for you so you have the peace of mind and knowing that you're never going to have to worry about an expense when it comes to that. How does that sound? Oh, I love that. What are you talking about? Well, we can bundle a hospital indemnity plan and a cancer policy that are going to pay you directly and that are going to take care of those expenses for just a little bit more than $1 a day. How does that sound? Oh, I love that. Perfect. Really what it's coming out to be is going to be about $45 to $50 a month on top of your Medicare Advantage premium of $0 a month, right? So really your costs right there, all in with your Medicare Advantage plan, your hospital indemnity, and your cancer plan are going to be about $45 to $50 a month. And that's going to take care of all your cancer expenses. That's going to take care of all of your hospital expenses and potentially more. How does that sound? I love that. Perfect. Then you move on with the app, right? It is that simple with trying to attach that, okay? Normally, if you get pushback in that situation, you didn't do the education process from the beginning in the Advantage plan and showing the exposures. So I would always just try to system build that and make sure you're really hitting on those expenses when you're going over the plan from the beginning, okay? That's how we can grow with that seminar revenue. What I want to talk about may not be for everybody because people may not be able to write annuities and life insurance, but we're a holistic financial planning firm. So I want to go over an example from March of this year. We had twin sisters that came to my seminar. Really what I did is I talked at the very end and I do my closing at the end of our entire firm. And I'm going to go over that slide for what we do in my seminar in just a minute. Those twin sisters are turning 65 this October. One's a widow, so one, has all of her assets, and the other is the spouse of a veteran. She had no idea about TRICARE for Life. Her husband didn't even know about TRICARE for Life. So she's going to be able to get onto some type of MA only plan and get a lot of great benefits. So we were able to provide that value from her just by understanding the rules, right? She had no idea, was so thankful of that, okay? We wrote $300,000 in annuities between the both of them, and I haven't even been able to write them their Medicare plans yet. How in the world will we be able to write that before I could even have a sit down and really write their Medicare plans? Well, it's as simple as this. What I do is I try to pivot our entire office and really what we do at the end of my seminar, because keep in mind, it's just me going to these seminars. Gary, our entire team doesn't go to these seminars. It's just me and maybe one of our client relations managers as well. So this right here is a slide that I use at the end of my seminars, and I'm going to talk to you all just like I'm talking to my seminar prospects that are in the office, okay? This is how we were able to uncover those assets just like that and set up a meeting to talk to them about rolling their 401ks over because they are retired into an annuity. So I just want to say thank y'all for coming tonight. Why would you choose Coach Medicare for your services to help you with your Medicare planning? Well, number one, our team of experts, they can handle Medicare as a full service and white glove agency with lifetime claims and billing service. That means you won't have to worry about haggling with the insurance carriers. We're going to take care of that for you. Now, I understand there's some HIPAA compliance laws that are out there, so sometimes you may have to talk to those insurance companies, but if you ever have something that you have the insurance company haggling you about, you can call me and know that I'm going to handle that so you have a peace of mind and knowing I'm going to provide that service for you with the insurance company. I'm also going to shop all of your Medicare and prescription drug plans every single year. That means I'm going to give you a full review. Most of the time, I'm doing right by you from the beginning, so we may not have to change that plan year in and year out, and that's okay, but your health may change as well. And if your health changes and your medications change, well, maybe your plan is also going to have to change. So I'm always going to provide that service for you during our annual election period that we talked about during our seminar earlier tonight. Guess what? There are no fees. I don't charge one fee for you. The only thing I charge is your time. And that means you taking a little bit of time out to meet with me and let me provide the value for you when it comes to your Medicare plan. And also, guess what? If you go to the insurance carrier directly, it's going to cost you the same with them as it's going to be going through me, right? So why not have an expert on your team as well? Relationships matter to us. We're a full service agency. You can see our team right here in our photo of Gary, me, Tide, Tim, Abby, and Bridget. You can see that we're a whole team, right? It's not just me that's helping you here. So you're going to be able to understand that relationships matter to us, and we truly care about you as the client. So we want to know about you. We want to know about your family and what you love to do with your life. Because guess what? We're also a financial services agency, right? I was the last missing piece to our team. I was the last hole to fill because we have 40 years of financial services experience, whether that be managed money in the market, whether that be insurance, life and annuities, whether that be long-term care planning, or maybe even estate planning. We have all of these services that we provide to all of our clients. And so we truly try to advocate by our clients and not with the insurance company. Okay. Now, I will say this, there may be some insurance companies that are best for you versus others, and we're going to be able to understand that and know that after we get to know you and know what you want out of your insurance plan and what you want out of your life when it comes to your health care and your financial planning throughout retirement. How does that sound? That's how I close all of my seminars right there. That pivots and shows them that I'm not just a Medicare person, that we're a full services, holistic retirement planning firm, right? After that was over with and we were going around and setting appointments, I'm going to send this PowerPoint complimentary to anybody. You do not have to be a Magellan agent or not, right? Please email health@magellanfinancial.com. That is health@magellanfinancial.com. We will make sure that you get this resource so you could really soak this in and you didn't have to worry about writing down all the notes. But I want to appreciate my time and that your time that you spent with us today. And God bless everyone.
All right. Thank you, Tanner. Hopefully you guys all enjoyed that. You got so much great information from Jen and Tanner and the information with educational and sales events. One question that did come in, people were asking, I think we covered it, but do you have to register all of your seminars with the carriers? If it is an educational event, you should not have your carriers' logos represented. You shouldn't be talking about logos. So you should be getting with whoever your compliance officer, whoever that upline is for those to make sure those are good. But the sales events, yes, you definitely want to make sure that you're getting those registered, approved with whatever carrier. Obviously, hopefully you've got involved with them and they're helping to finance that in some way. But also remember that during your AHIP and then during the certification process, all of your carriers have stuff about how you have to register their events and that good stuff. All right, so continuing with cross sale, we have a very exciting new venture that we have taken on here at Magellan with a new product with American Home Life. American Home Life has been around for many decades, and they're going to kind of talk about their process, their carrier, where they've kind of come and gone. But we have Steve Lobel. He's the president and CEO. We also have Tom Lobel. He's the executive vice president and chief marketing officer. And then we have Kyle Ingenthron. He is the national sales director. They have come out with a brand new product that we are very excited to partner with because it has an amazing cross sale with your Medicare supplement clients and the life insurance side. So that's a great, easy cross sale when you're first getting started trying to do that in the industry. So without further ado, we will bring these three gentlemen up and let them kind of take over.
Good morning or good afternoon. My name is Steve Lobel, and I'm the president of American Home Life. American Home is a purely mutual life insurance company that's been in Topeka, Kansas since 1909. I've been affiliated with the company for many years. When I started, we were about 15 million in assets, and this year, I believe we'll go over 300 million. We're about a 50 million revenue company. It's a small company. Small companies have advantages over large companies, and they also have disadvantages. But we have about 25 full-time employees. If you call, you'll get to talk to a human being, not a menu. We intend to continue that for as long as we can. We deal with many older customers. We've been very heavily involved in the final expense business since 1995, but we have a full category of other products as well. We have a non-par whole life product that's very easy to sell, and we have an annuity that pays 6%. So with that, I think I'll turn it over to the younger gentleman here and let them tell you about the company and the specifics of the product that I know you're interested in. Thank you.
Thanks, Steve. So I want to thank everybody here, Kim, Six Killer, and Magellan for inviting us to be a part of this event. We're really excited to be here. You know, Kim talked about the holistic approach. I think Tanner talked a lot about that too. And so what we're going to talk about today is our Medicare supplement product, but also a final expense add-on product that a lot of you may not be familiar with. So to start, we'll talk about we're in 33 states. Can you go back to that last slide? Yeah. So the Medicare supplement is in 33 states. Our final expense is in 35 states. And to talk about the Medicare supplement, it's built on Aetna's chassis. So it's a shopping cart style e-app experience. You've got instant underwriting decision. That's going to show up on the app as red, green, or yellow. Yellow goes to underwriting. We've got a really unique thing coming in August of this year. It's called reflexive questioning. And what that does is when you get a yellow on an underwritten, it's going to take you to a different menu where you can answer those questions instead of being referred to underwriting. So it's going to speed up that process for you. And there's no mandatory telephone interview. Plans available, A, F, G, and N. We've also got age banding on ages 65 through 68. What that does, you know, as we're marketing this product, the Medicare supplement market is very competitive, and there's been some uncertainty about new products on the market and their rate stability. Right now, our underwritten percentage is 77%. Some of that is a result of our age banding. So age 65 is competitive, but it's going to be more competitive at age 67, 68, which requires underwriting. That high underwritten percentage keeps our block healthy, which helps us with rate stability. And right now, our rate increases this year, we're averaging about 2%, which the industry average is 5 or 6%. So you're going to see, right now we're top 3 rates in a lot of states, and we anticipate that to get better as the year goes on. Additional benefits, you've got $125 underwritten application bonus. It's telesales friendly, no height weight chart, and no appointment fees. So that was our Medicare supplement product. Our final expense plan. Most of you aren't familiar with final expense life insurance. It's a standalone product. It's got 3 tiers, 2 level tiers, and a 1 year or a 1 tier that's a 2-year return of premium. There's also, when combined with the Medicare supplement product, there's a 20% discounted super preferred tier. And that's what we're going to talk about when we're combining these products in that holistic approach. There's also great rates, comp, the wide age and phase amount ranges. You've got the accelerated benefit rider, accidental death benefit rider, and the child term insurance rider. And again, it's built on the Aetna chassis, so shopping cart style, instant underwritten decision. Right now on our final expense, those reflective questioning, that's effective right now. So if you go in through the application process, you'll see that yellow and those questions are there, so you can get a more instant decision. And again, no mandatory telephone interview. There's additional benefits to the agent, $150 application bonus when it's applied to the combined with the med sup. It's telesales friendly. Again, no height weight chart, no appointment fees. And then we have all Social Security billing dates. And then the med sup combo. So when we put these together, there's it's an instant decision. It's automatically approved if you're doing an underwritten med sup policy. And you get a real 20% savings. So Tom's going to talk about kind of rates and how that looks. But there's the product is competitive. We've got 2 separate competitive products, and we're putting those together. And our final expense has got a 20% discount. The med sup also has a 7% household discount. So there's added compensation for the agents when you combine those together. It's an ultra easy enrollment process. So it's a 1-click, all the information, all the health information is carried over to the final expense application. You're entering a few things like beneficiary, and then you're done. The current attachment rate is 14%. So right now our agents have a 1 in 7 of their med sup appointments. They're adding on this final expense plan. And what that does is that increases overall revenue almost 50%. I mean, 43, 48% when those are combined together because of the high comp on that final expense plan. So I will turn it over to Tom and let him talk a little bit more about that.
So I get the easy job today, and that's to talk about the secret sauce that makes these numbers possible. So the 14% attachment rate, again, 1 out of 7 folks who sell one of our Medicare supplement plans are selling a final expense plan. 1 out of 7. So we're going to have a slide on exactly what that's going to mean for you as far as comp. I'm going to highlight just a couple things on here because we have gone over a whole lot. So there's 3 things that really make it work. Okay. Number 1, it's real value. So that's the 20% savings. We're going to show you a picture of the slide. The second thing is added compensation for the agent. We're going to show you exactly how we get to that 43% number for a 14% attachment rate. And then it's got to be easy. Okay. So probably the Medicare supplement carrier you're selling has both products, both being Medicare and a final expense. If you're thinking to yourself, I've never sold a final expense plan, either as an add-on or standalone, you're exactly who we're talking to, okay? Because this is not built for a final expense producer per se, who's going to go through a 45-minute presentation, walking them through, the experience of going to the funeral home, et cetera. This is for the Medicare supplement agent to talk to your prospect about final expense. All right, so this is for you. I will just add one more thing about the 14%. That is all agents, okay? So we have agents that are attaching this over half the time. We have a lot of agents who just like our Medicare supplement product. They don't sell any of it. So if you can be average, you will increase your first year comp over 40%. I'm going to skip ahead here. So we'll go in order. So I'm going to talk a little bit about the rates. So again, I think if you're going to try to cross-sell a product, obviously the base product has to have a lot of value to it, has to be easy, has to stand on its own. But that secondary product, I think there's a lot of hesitation sometimes with certain agents, especially if they are newer agents, to try to, do the twofer and add one on. So we built this specifically to be a deal that you shouldn't feel bad trying to bring it up. You should feel good, and you should feel obligated to bring this up. There's that much value built into the plan. If you don't at least bring it up and allow your client to object or say no, I think that you should reconsider. So I'm going to show you the rates here. You can see them on the screen. Top, it's a $15,000 plan. You can see our rates versus, and I put some of the low rate carriers out there. So our super preferred versus our first tier level, which is our preferred plan. So you see it is a true 20% discount. Okay, now I put some average final expense carriers out there, and I put some low rate ones. All right, so Mutual of Omaha, they are offering $83 for 15. You can get 2 first digits lower. You can get into the 60s with this plan. Okay, so there's a lot of value from a price saving standpoint by bundling our plan with the Medicare supplement, which is also a top 3 rate. Okay. So we're going to talk a little bit about the comp now. Okay. So again, we talked about the 14% attachment rate and the 43% increase. Those are great numbers that sound great in an advertisement and an email blast. Obviously, we all see these every single day as licensed agents. It seems like you can't go 48 hours without somebody telling you they're going to, quadruple your business, right? So what do the numbers actually look like? Okay. Here it is in plain English, plain numbers, an average Medicare supplement commission, all right, 22% with the associated comp. Then we go down the Patriot Series FE commission, 115% street. Now that comp is 115% times our actual average super preferred final expense case. Okay, so that's not hypothetical. Our average is about 111. Okay, those are real numbers. And then as Kyle brought up earlier, if you do sell a fully underwritten med sup with us, you get a $125 bonus. And then if you sell a super preferred plan, so add on the super preferred plan to the Medicare supplement base, you would get that $150 bonus. The best calls I have ever got are from agents who have just sold their first final expense plan. When they get that first year check on the final expense versus the Medicare supplement, that's a really good call to get, whether you're an agency manager or a marketer. All right. So the equation on the left, we're just going to talk a little bit about it real quick, but the long and short of it is, if you take the money that you will make from selling from a super preferred final expense plan, and you add that to what you typically make selling a Medicare supplement plan, and then you apply our little 14% factor. All right. So if you can just do that 1 out of 7 times, the math right there shows you exactly how you get to a 43% increase in first year comp. If you're a first or second year Medicare supplement agent, that has to sound very, very appealing, because those first 2 years are tough. If you're an agency manager and you're recruiting, right, or a principal, you're bringing new agents into the business, your retention is going to be a whole lot higher if you can increase first year comp by 43%. Okay. So it's for everybody. Let's see here. So we've talked about the savings for the client. We've talked about the added compensation for the agent. And now we've got the secret sauce, which is making it easy. Again, the carrier you're selling right now for Medicare Supplement, they probably have a final expense. They probably have a life insurance plan. If you have not sold those plans to your prospects in the past, or you're not doing it at a 14% rate, that is not your fault. That is your carrier's fault. Okay. They have not made it easy enough to do it. And so we have brought kind of our final expense knowledge. We've partnered with Aetna, who has a Medicare Supplement, and we have made it a seamless process. Okay. So what it is when you sell a Medicare Supplement plan, and on the shopping cart style e-app, which everybody's familiar with, and you add that plan, add the Medicare Supplement plan to your cart, you are going to get a prompt. Okay. The prompt is going to tell you, your client is eligible for a 20% discount final expense plan, a couple other sentences just to make the segue to the final expense question, all right, with your client. Hey, Ms. Jones, did you know that you could also qualify for a 20% discount final expense? Most folks from 65 to 75 are either coming off their employer insurance, or they might have an individual term insurance plan that's expiring. Would you like to at least take a look at the rates? Okay. If they say yes, then you go to it. If they say no, ask how much they're paying. They're not going to know how much they're paying. Okay. So that's the segue to get there. Now, if they do have something, chances are it expires, or if they were in the minority of folks who did set up a whole life plan, try to replace it, right? We've got a 20% discount on the market plan. All right. And we do have agents do that. So it is that easy in terms of the prompt. I will also say, again, that is for the agent and the customer, but it's as big of a value add for an agency manager. If you have new agents, their comfort level on the base product, which is Medicare, might not be as high as it needs to be. Trying to get them to go that extra mile into the second product can be even that much more difficult. If the prompts are built into the e-app flow, there's really no excuse for when they come back with a Medicare Supplement app. What did they say when you asked about final expense? They can't really say they skipped it because they're seeing two prompts. Okay. The other thing I will say is the quoter in the e-app is built right into the flow. So if they do say yes, it's going to show them a default picture of 10,000 FE. Okay. If they want 25, the quoter's right there. You don't have to get out of the e-app, go start a whole nother thing, enter in their name, their date of birth, all that kind of stuff to get a quote. It's built right there to be as easy as it can be. Now, when they say yes, 1 out of 7 times, if you're average, again, we have agents who are closing over 50% of these from an attachment rate. All you have to do, and this is the screen that pops up right here, it's going to tell you all of their information, their name, social, date of birth, their answers to their health questions, all their payment detail. All of that is going to auto-populate the final expense application, so that all you have to do basically is collect a beneficiary. Okay, you don't have to say, okay, let's get through this, and then you get through the Medicare Supplement sale, and oh, Ms. Jones, you said you wanted to look at these. Let's go back and look at these. They're tired by that point. Okay, so, and you got to get to your next sale. So it's built right into the e-app flow. Click a button, ask one question, who's your beneficiary? Everything else is taken care of. All right. So with that, I would just say on behalf of American Home Life, thank you to Magellan for having us. We can't encourage you enough to try our products. We think you'll like it, and we look forward to working with you all in the very near future. Thank you.
Thank you.
Thanks, guys. Hopefully you all found that product very interesting. I think it's awesome to have the opportunity to get that final expense in for the clients whenever you're working with those Medicare Supplement underwritten sales. Our next presenter, you've already seen once today, is Toby Roberts. He is the Vice President of Marketing at Cody Askins Marketing. Toby has been helping us with a lot of this event today, obviously, and then he is a world of knowledge on all things marketing related, whether it's digital, in-person, seminars, mail, all the things. So If you have any questions for Toby, put those in the chat. We'll be watching those so we can get some of those questions answered live as well. And without further ado, we're going to bring Toby up to join.
So, a little bit of housekeeping first. There was one question for the gentleman I want to take from the chat. How do they get appointed with your product before we move on?
We have, you can get it through Assurance Bay, but really what you need to do is just call Magellan and they will get you taken care of. The contracting usually takes 5 business days or less.
Okay, and then one follow-up that I just got. Is it available in California?
Not currently. So it's all of the blue states on the map that we showed earlier.
Perfect. Okay. That was all. Just a little housekeeping before I get rolling. So thank you, gentlemen. All right. So you've been on for a few hours, right? Let's stretch it out a little bit. I was doing some calisthenics back behind. But I am going to get rolling into leads, marketing, branding. My topic is really going to be 5 lead strategies for AEP. And then I'm going to throw in some bonus things that won't break the bank. So first and foremost, here's what I need you to do. Stop buying leads, right? The lead guy standing right here just told you to stop buying leads. Why? Because you're not working them properly when you buy them. You don't know your numbers, like Tanner said, right? If you don't know your numbers, you don't know what's going to work and you're going to waste your money. Guess who you blame when you buy leads and waste your money? Anybody? Anybody got a guess? The lead guy. I don't want to be the reason that this doesn't work for you. So I want you to understand your numbers first before you ever buy a single lead. I want you to understand your numbers before you ever buy from Leading Response and do a seminar. I want you to understand what is going to work for you and how it's going to work before you ever spend $1. So we got that out of the way. You're not going to buy leads until you know what to do with those leads. So now, first strategy, first thing I want you to understand is direct mail. Jen was up here earlier. Leading Response, number 1, we recommend all of our marketing clients for Medicare out to Leading Response. They do it better than anybody else in the industry. Don't believe me? Try some others, and then you'll know I'm right. I have clients across the country who have tried other vendors. We will not name names. They always end up at Leading Response where they're the happiest. If they leave Leading Response, I promise you they go back. So Leading Response knows direct mail seminar marketing. I don't recommend anything else. Don't go anywhere else. Spend the money there where they will help you. That white glove service is no joke. They will handle it soup to nuts, beginning to end. They will help you through the entire process. They'll even call on people if you want them to help get people to the seminars with all the registration. They'll do it all. I promise. Jen's back here nodding her head. So I'm not going to go deep down into direct mail. We've heard it all. So I'm going to skip to strategy number 2. Number 2 is going to be TikTok, right? Digital leads are the most prevalent lead that you can get. You can get hundreds of digital leads, but you have to be able to work them. TikTok is super easy to get going. It's not deeply involved. There's not this huge ad platform that you have to try to learn. There's only about 8 things you have to do to get started on a TikTok campaign, right? It is now the Wild West of digital marketing. It's where Facebook was 10 years ago. It's where Facebook was when I started doing digital marketing, when Facebook didn't allow you to advertise. So there's only a few things on TikTok. And what you need to know about TikTok is that you just need a short little video, about 25 seconds. When I say short, very short. Then you need to get your call to action ready. You need to know where they're going to go. So you're going to need some type of landing page, unless you run it through TikTok native, which is fine. You can run it straight to their forms, and that form will drop it to a Google Sheet. Or if you know how to use Zapier, I may be talking way out in left field here, but if you know how to use Zapier, you can have it go straight to your CRM. If you don't know how to do that, I know somebody who does. I have an entire team that all they do is help agents generate and direct leads so that they get opportunities. Now I'm going to pause for a second. We've talked about 1 and 2, right? But what in the world do you do with the lead once you get it, right? You got to work this thing. If you spend $20, $30, $40, $50 on a lead, what are you going to do with that lead? You got to call it, right? You work this lead until the lead doesn't work anymore. If you're going to spend $50 on a lead, I promise if you don't work that lead heavily, if you call it one time and you call me, we're not going to have a good conversation. If you call that lead 15, 16, 20 times and you said, I've worked this thing to death, it doesn't work, then we'll have a different conversation. But work your leads like you just paid good money for them. If you're going to buy 10, 20, 30 leads at a time, you're paying 30, 40, 50 bucks a lead. That adds up. That investment is what generates your opportunities, right? And that's all a lead is. A lead is not a guaranteed sale. A lead is an opportunity for you. A lead is an at bat. What you do with that at bat is up to you. The person who puts you at the plate can't hit the home run. That's up to you. So strategies 1 and 2, we got direct mail, we got TikTok. I don't spend much time on TikTok. It's kind of the Wild West. Like I said, it's new. People like it, but you've got to be comfortable on camera. So if you're not comfortable standing up here in front of a camera for at least 20 seconds on your cell phone, right? Shoot it vertically. It's easy. 20 seconds is all I need from you. So we could shoot a TikTok right now if we wanted to. Kim's back here taking photos, shooting TikToks, posting online. I see you. So it's not difficult. Just you have to be comfortable with being uncomfortable. So number three, what am I going to do if I don't want to do direct mail, which, let's be honest, the only reason you wouldn't do direct mail is if you can't afford it right now. That'd be the only reason you should not do Medicare seminars. If you're doing Medicare, the only reason you don't do it is if you can't afford it. So if you can't afford that, you're not going to be able to afford number 3. So the most successful agencies that I see out there are doing a combination of a lot of these things. This one is big. This one's television. If you want to reach the senior market, they still watch a lot of local TV. They still watch a lot of news. They still watch a lot of 6 to 9 p.m. television, and even daytime television. Do your research or find a partner. As I tap the mic and Trey freaks out. Sorry, Trey. Find a partner that can help you walk through this process. If you want to have a strategy session, there's a QR code on your screen. Click it. Click the QR code. It's going to take you to all the resources to download. Once you download those resources, you get in there, sign up. There's a QR code at the very bottom to have a marketing consultation with me. Costs you nothing. I'll do the same thing you guys do for your Medicare clients. I won't charge you a fee just to talk. So that QR code, that'll take you to my calendar. You can set up a time. We'll go through it 15, 30 minutes. We'll go through all of your marketing if you'd like. I will help you step by step figure out what you should do. So television. Television is the most expensive thing you can possibly do, but it still has the reach that a lot of agents in a local market are looking for. So if you do TV, you need to have a bunch of different things. You need to have a website. If you don't have a website and someone sees your commercial, what's the first thing they're going to do? It's not going to be call you every time. It's going to be they're going to do their research. They're going to figure out if you're even legitimate, right? They're going to look on Google. They're going to see that you have a business. Oh, this person has a website. They have their photo here. They seem to be legitimate. Now I will call them, right? Now what you're talking about is having a full marketing strategy. You need a website if you're going to do television. Same thing goes with if you're going to do what's called OTT or streaming. If you're going to do streaming, you have to have a website. You have to have a brand for them to go search for. If you don't have a brand, again, find a partner that can help you develop. It doesn't have to be this 50-page, 100-page website with all these bells and whistles, right? It doesn't have to be that. It just needs to be 1, 2, 3 pages that talks about who you are, what you do, why you do it. Don't get too in depth. Don't think it's going to be this big, long, drawn out process, but have the resource there for them to find so that they don't look at your TV commercial and then bounce away when they don't find you and now they don't think you're legitimate. So TV, that's the number 3. So number 4, I already kind of mentioned it, that's streaming. It's the new sexy thing for 65 to 75-year-olds. A lot of Netflix, a lot of Hulu, Disney Plus, right? Everyone is getting some type of streaming service and unplugging from traditional. Traditional still works, still a big market, but the footprint is changing and you need to know that. So as people adopt streaming more and more from the 65 plus market, you're going to want to change with that. Streaming is super easy to do. You find a partner to do that one. That one takes a lot of time on the back end to develop what's needed. Same with TV. You need to find a good partner there. Don't mess with those on your own. Find a partner. Doesn't have to be us. If you don't choose us, great. You go find a partner though. Don't be the person who gets lost and then doesn't do anything. So number 5 is the one I'm going to talk about quite a bit. Number 5 is Google, right? Google YouTube strategy is probably the most prevalent, most buy-ready lead that you can generate digitally. So what happens with Google? Let's talk about what you see online a lot. Facebook, TikTok, even TV to a certain extent is a billboard, right? Imagine driving down the road, you see a billboard. Same thing happens when you're scrolling through social media or watching TV. It's just a billboard ad. Google, YouTube, on the other hand, is not. It's not a billboard ad. These are direct questions, right? You go to Google, you type in Medicare help near me. Medicare help, Chattanooga, Tennessee. What that's going to give you is a list of results. You want to make sure you have a Google My Business page as long as you have a physical address to direct people to. If you're working out of your home, sorry, but they don't let you do that. The last thing you want is a bunch of people showing up, ringing your doorbell anyway. So have a Google business page. Then you're going to want to run a small budget on Google. And by small, I mean $500 to $1,000 to start. Run a small budget. Test out what your market is doing. Don't go to the ends of the earth to try to spend a bunch of money. Test out what the market is going to respond. So you're going to buy these keywords. You're going to sign up for all of these things. You're going to buy keywords such as Medicare Help, Chattanooga, Tennessee. And if you're a tanner, you want to have this now direct to a landing page that either has them book a time with you or has them call you. So you want to try to qualify these leads that you're spending money on. And you don't ever pay for a Google lead until they've clicked to your landing page. So it's no longer a billboard, right? They've deliberately searched for what they're wanting answers for. So you can get a much better lead on Google and YouTube. YouTube is just a little different. Same platform, same strategies, but YouTube does require that you shoot a video. Again, doesn't have to be this big drawn out thing. Just has to be a small video, short video saying who you are, what you do, how to find you for more information, right? Nothing too involved. So that's 5 strategies. If you have a question about any of these strategies right now, stick them in chat. My team will flag me right now and we'll get them answered. So if there's any questions, I'm going to look to the left right now. Oh, look at that text message. Okay, here we go. Question. What budget is needed for spend per platform? So I never have anyone start out with a massive budget on any platform at all. The minimum budget you ever need on social media, minimum, is $500. Right? That's where you would start, and that's for a month. So $500 a month. If you can't spend that, then what you need to do is start with aged leads. Aged leads are typically something that you can buy. They're 2 to 60 or 2 to 90 days old, depending on who you get them from. And you can usually get them for around $1. They're $1 because they are an aged lead. Don't think that those are guaranteed sales, but those are a great way to try to turn a quick ROI if you don't have the money to spend on a campaign. So that's what I would say. Minimum $500 on social media. Google, minimum $1,000. It can eat up money a little bit faster because you are having to spread that out amongst a bunch of keywords. So if we don't have an online presence, which platform should I start with? TikTok. If you don't have an online presence, then you need to start with TikTok. Even with Facebook, a lot of times they'll do the research. You need to have a TikTok page. You shoot your video, go through the ad platform. You can even Google how to set up a campaign on TikTok. Same thing with Facebook. You don't have to do it. If you have more time than money, do the research. If you have more money than time, hire someone so that you can focus on what you're really good at. So, how important is it to generate branded leads as opposed to PLOs? Not as important as everybody makes it seem. So, you can generate, what the difference is, I'm going to break that down for anybody who doesn't know. Branded lead is going to be branded directly to you. So it'll have your name, your agency name on it. A PLO is per lead order, where you're buying leads in bulk from someone that generates them real time on their own assets. We do both. We have not seen a huge conversion difference with agents from a per lead versus a branded lead. So if you don't have to set up a campaign, you can just buy leads at a retail price. But if you want to set up the branded, sometimes you can save some money because you can generate leads at a lower cost rather than paying a retail with margin. So keep those things in mind. How long does it take to get high intent leads on Google? Is it short term or long term? It is not incredibly short. Our team can usually set up a Google campaign in about a day and a half. One thing I will mention, right? You must be G2 certified to run any health insurance related items, Medicare included. I recommend it for anybody who runs insurance because they will flag you. Even if you're running life, sometimes you will get flagged. So G2 certification can take anywhere from 5 to 10 days for Google to get that back. You have to submit all of your state licenses. They did this to try to get rid of all of the jokers. So I like it. While it takes a little extra time, I like it because it's now cleaned up that marketplace for us. So only legitimate advertisers, only true agents can market. So once you get that certification process done, our team can have it turned in about a day and a half, and then you'll start generating leads. So typically I tell people you'll see your first leads come through in about 2 weeks, including that G2 certification process. So here we go. What is the lead intent difference across platforms? All right. I call this the lead ladder, right? We start at the absolute bottom. Let's see if I can put the ladder right here about where the short person camera is set. So lowest possible intent of a lead is an aged lead. Aged leads, like I said, they're bottom of the barrel leads. They're aged for a reason. They're only $1 or $2 for a reason. Once you get past aged leads, then you go into social media PLOs. So PLO branded about the same level. Those are being generated at a retail cost. Then you get those. A step above that is going to be TikTok. TikTok is a little different because it has a little bit higher intent because everybody is doing it from their mobile phone. Most times you don't get garbage numbers put in. I say most because sometimes they still put in the garbage number. So from there, you step up to Google and YouTube. Then you have direct mail. And then what everybody loves, referrals. The no cost one here at the top is the highest intent that you can do. So when you talk about that, that's really the level. That's what I call the lead ladder. And what you want to find is based on your budget and your propensity for risk, because it's not guaranteed. Like we said, leads are opportunities, not sales. So your budget determines where you should fall on that lead ladder. Do I need to be in the videos ran on YouTube or TikTok, or can it be someone else? It can certainly be someone else. Our largest clients are not on camera. All you have to do is pay someone. You need a script. We've got tons of scripts that we've written, probably hundreds at this point, where we go out and we hire an actor, or we have someone from our office actually get on camera. So you don't have to be that person that's on camera if you don't want to be. I recommend it because then it puts your face to this. But if you don't want to, you don't have to. Who offers the G2 verification? So that's actually a process. Google has, I believe it's Verisk. I may be pronouncing that name incorrectly. They actually process the G2 verifications. So if you are looking for that, you can Google G2 verification, and they are the only source to get verified. So, any other questions before I move on? Team, hit me with all of them. All right, we're moving on. Now, we've talked about all the things you can spend money on, right? We've talked about all these lead ladder items. Now, what do you do if you're not looking to break the bank? I've touched on a couple of them already. The cheapest lead that you can do if you don't want to break the bank is age leads. If you're not looking to break the bank, you just need leads to call through, or maybe you're a new agent, right? Or if you're building an agency and you've brought on some new agents, age leads are great. And so what you can do with your age leads, you give them to work on their script, work on their cadence, work on trying to get someone to close. You work on getting them on the phone if you're doing telesales, or if you're doing face-to-face and you're sending them out in the field with some FE leads or something like that, you can really cut the teeth on age leads without breaking the bank. So that's that one. Get back here. So the next thing is do it yourself. If you're not looking to break the bank, learn how to do your own leads. Doing them on Facebook or TikTok, and do them yourself. You can cut out the cost of having a partner. Our services are not free. We pay experts in their field to do the work for you. But if you're looking to do it on a budget, don't pay someone like us to do it. Learn how to do it yourself. Use the time that you have available. Watch YouTube videos. Don't pay for the courses that you will see online when you search for these. Do not pay for a course. It is the same thing that you can learn from a YouTube video. And Magellan has a freaking course for you, right? They have a course. Why in the world would you pay for one? If you're a Magellan agent, they'll give it to you. They'll teach you how to do it. So please don't pay for a course. So the next thing to not break the bank, right? We've talked about age leads. We've got Facebook or TikTok, DIY, do it yourself. Is, goodness gracious, networking. Why would you not figure out how to get in with the people who can help you generate leads? I've got so many clients that what they do is they work not just a warm market, but they make relationships with doctors, with hospitals, with nurses, with long-term care facilities. There's another course on Magellan for that. It's Kim's whispering past the camera. There's all these things that you can do. I'm glad I brought all these points up so that Kim can point out all the things that she has to help agents with. I don't know who helped her develop all these resources, but I've got a pretty good idea. What we love to do is get agents. We love to help them. We love to give them the resources to do it themselves. We love for you to be successful. Because the more success you have, the more success we all have. So learn how to network. Learn how to work through all these people that can help refer you items. Because the next thing that I'm going to talk about is referrals. If you're not doing referrals, you're not truly working all of the contacts you have. If you're not asking someone who just put the confidence in you to help them, how you can help other people, how you can help their friends, how you can help their family, then are you truly trying to help them? Or are you just trying to collect the commissions? Learn how to ask for it. People will tell you who else you can help that's in their circle. If you truly help them,
They are more than happy to share names, contact information for the other people you can help, right? Learn how to ask for referrals. So the last thing I want to talk about is what I call mining your diamonds. So a lot of people call this cross-selling. It is cross-selling on steroids. It's not just cross-selling face-to-face or over the phone when you're closing. I want you to take a look at your book of business. I want you to figure out who is only doing one product with you and what other products you could cross-sell after the fact. These leads have costed you nothing at this point. They're signed with you. That expense that you may have had to have them come into the company, it's gone. Your diamonds are sitting there waiting for you to mine them. You've got someone who's on MAPD. Maybe they don't have an HI or an FE to go coupled with that. Why are you not going back to these people who trust you with their healthcare to offer them another service? Mine your diamonds and use those contacts that you have in your database. Send them text messages, send them emails, send them a casual direct mail piece, right? Learn how to mine those diamonds so that you can maximize your database of clients. So, with that said, any other questions before we move on to really some of our last speakers? Any other questions in chat that we want to knock out? Oh, they say, look at your phone, you idiot. Okay. Here we go. Tips for recruiting agents digitally. I love this. Recruiting is one of the things we help the most with. So the trick to recruiting is that you have to work it just like a lead that you would sell. Recruits these days are terrible at one, getting on the phone for their interview or showing up for an interview. They suck at it. They're terrible at showing up. You will go through and you will say, all right, I had 50 recruiting leads. Only 25 of them showed up. Did you work them like you were trying to sell them? Because if you are paying for a recruiting lead, work it like you're going to sell it. So the tip to generating it is you have to be consistent with your message. You have to look at all different avenues. Indeed is probably the highest intent recruiting lead that you can get from what you would pay for. Your agents really are your best source for recruits. They know people that are looking for jobs. I don't know how many people in this room or that you know that started out thinking, you know what? Insurance is what I'm going to do from 18 on. The only person I know might be Kim's daughter, Ava. Right? No one got into this business on purpose. They didn't graduate thinking, all right, I'm going to sell insurance. It's my passion. It's what I'm going to do forever. No, they got into it because they saw the opportunity. And the people that are inside your agency that are doing well, their friends, their family see the opportunities and the success that they're having. I promise you they're going to want a little piece of that. So learn how to get those agents to bring on more people that they know. That's the free one. Indeed is the highest intent that you can pay for. So Indeed has made some changes to where if you're trying to recruit into a local market, you do have to pay a pretty penny. It used to be that we could get recruits pretty cheap on Indeed. Now I think it's $750 per market that you're in, per city that you're in, which can get very expensive. So beyond that, the next thing you'd want to do is Facebook. You can generate Facebook or TikTok. You can run recruiting ads just like this, and what you want to do is focus on your targeting. You want to target people with interest in entrepreneurship or sales and bring those people in. So back to the DIY stuff, it's just a different type of ad. So that's all the questions we have. We're going to bring Kim back up, and then we are going to get into our next speaker. The next one is going to be over Zoom digitally. We're all going to take a break, eat a little food, and then we're going to be back here for a panel right after that.
Thanks, Toby. Toby kind of started our final little bit of talk that we're going to have before we have our Zoom and then ultimately our final agent panel this afternoon. And that's really just talking through some of the resources that Magellan has to offer for you. So I know I've talked a little bit about Magellan today, not a ton, but because we are here really about you and getting you ready for the annual election period. But I just want to tell you a little bit about Magellan. So Magellan Financial has been around for almost 2 decades. We are in our 19th year. Started by our owner, Brian Rice. He is an amazing gentleman based out of Arizona at the time. And he was an agent and knew that there was a better way to do things. And so the company was really born through Brian and his partner at the time. Through some events, and you can actually see the entire story about Magellan out on our YouTube. My partner, Jared Florence, president of Magellan Financial, tells it way more eloquently than I do. Through some events, they met with Jared, and Brian became partners with Jared Florence, and they put our main office here in Topeka, Kansas. So Magellan Financial is based here in Topeka. They have all of their marketing staff, for the most part, with Magellan Financial is here. And then also we have a television studio and our assets under management team all out in Phoenix, Arizona, and that is known as Foundations. Several years after they started the financial side and the foundation side, then was Magellan Healthcare born. And so Magellan Healthcare was born, and we are also located here with Magellan Financial. We're sister companies. And really the idea behind it was adding that holistic thing. So Brian and Jared are out building an amazing business, with amazing staff, amazing agent partners, and really saw that holistic side of Medicare was needed, the healthcare side. So I joined the company 3 years ago to help with the Medicare side of things. And in the last few years, we have built out a full agent portal for you. So those of you that work with Magellan or would be coming on with Magellan as partners, we have an agent portal where all of our resources lie. So that's where all of our seminars are at. We have flyers, different appointment guides, and then a lot of the trainings that you heard Toby talking about. So we do have trainings that we do on how to work leads, how to work seminar leads, how to partner with doctors and build your own little BNI or your own little business group. So what partners can you do to get those grassroots going in your community? As far as obviously, we really hone in and focus on anything that is related to your compliance, because we want to make sure that we're telling you what's going on so that you can really focus on what you do best. And that is selling, taking care of your clients, and helping to stay up with the products in the area. In addition to that, we also provide for our agents all of the sales systems that they need. So through our partnerships, our agents do get access to a system called Sunfire. Many of you are familiar with that platform. It is a priceless system because it allows you to get in, do Medicare Advantage and prescription drug sales. It allows you to do the scope of appointments. And it does have telephone integration to make sure that you're staying compliant for your sales, whether they're on Zoom or over the phone. It will let the clients quote whether they have the contract or not for the different carriers, so that they can ensure for the clients that they have that peace of mind that they've truly holistically looked at their market to tell them which plans are the best. In addition to that, we do have another quote tool that we use. We use it through CSG. That quote tool allows us to do the Medicare supplements, the ancillary, and then one of our favorite pieces in that we partner, once our agents know what Medicare Advantage plan they're selling a client, you can fill the gap is what it's called, and help with the hospital indemnity. Now, as Tanner mentioned earlier, once you've been doing this a while, you're going to know which products you feel are best in your area. But when you're first getting started, it's overwhelming, right? We know there's literally hundreds of carriers when you look at all the local carriers, regional carriers. And so that's where our team really comes into play. We'll help you figure out which carriers make the most sense. We will also help you by giving you that feedback on what we're seeing on the customer service end of things. You can scan the QR code on the resource page to join Magellan Healthcare and also see all that we have to offer. One of the things we also want to give you is a piece of information that our agents are using You heard Jen talk earlier about the seminars and how the recent changes with CMS, the Center of Medicare and Medicaid, you can no longer have those appointments set within the educational event. And as she mentioned, it shouldn't be that big a deal. You're explaining things to them, you're teaching them, you can follow up because you're still getting that permission to contact sheet. One of the things that our agents all have, and they've had it for quite a while, is they have their own QR code. It is at the beginning of their seminar slides. It is at the end of their seminar slides. It also typically is framed and sitting on the sign-up table when clients are coming in. That code will take you directly to a landing page that has really one action. That call to action is scheduling an appointment. We still feel like that at this point in time is completely within compliance. You're not mentioning it, you're not talking about it, it is just appearing there. And so that would be our tip to give you is if you don't have a QR code, you need to get one. You don't have to totally, but stop offering appointments. But I agree with Jen, it takes the in-your-face pressure off. It's also going to increase the intent of your lead, right? Because they've chosen to go ahead and make that appointment with you. So our last presenter that we're going to have before our agent panel is one of our carriers based out of Texas. We're very excited to have him joining us. He is still finishing getting onto the Zoom. So we are going to take one moment and we're going to bring Tanner and Toby back up.
Yeah, let's see if we can
How are you
frame-
gentlemen
see
doing?
if we can frame up this short camera and the tall camera.
They're short and the tall, put the
It's
tall in the
gonna be
center.
interesting. Squat down a little bit if you want.
Let's go. Here we go.
Do you need my heels?
Ooh, I don't think so.
Okay.
Yeah.
I know we're in 2023, but
I really want to know. Why you partnered with Magellan when you started out. You've been in, you said 3 years, right?
Right.
Why partner with Magellan?
So it ended up being an amazing opportunity for us because we were already with Magellan on the financial side. And I think that having a partnership that's all inclusive when it comes to a holistic retirement planning agency, both on the financial side and on the healthcare side, has helped us be able to just focus on growing our business. You know, Magellan does an amazing job with all of the back office, whether that is pending apps, contracting. There's a lot of different things and moving parts that a lot of people don't see when it comes to running an agency. And so Magellan has really, really helped us scale in that aspect because what you were saying, we're on TV, we're on radio, we have podcasts. And so we do a segment every Friday with one of our news stations called This and That. And really, James Howard, his actual 30-minute presentation that he does every single day, but we're on every single Friday. That right there reaches more people age 55 to 75 within a 100-mile radius than any other TV show. And so we're able to go on there every single Friday for Financial Fridays and be able to provide people with resources, whether it's me that goes on for the healthcare side or whether it's Gary that goes on for the financial side. Sometimes Tide goes on. But what that was done was set up by Magellan. Magellan was able to come in and help with these news segments and be able to really negotiate those prices and get us on. So what they do from a marketing side with helping with TV and radio have been amazing for us and helping grow our agency. But normally, like on the healthcare side, it's just me. So like I'm the one that is managing and the principal of our healthcare agency. So if I tried to do all the contracting, if I tried to do everything on the back office, it would be a nightmare, y'all. And so Jen and Kim are my life supports, and they do an amazing job of that. Sometimes probably I annoy them a little too much and they get that, but they call me back and I know that. So I know when I get that button that they're busy, right? They're going to call me back later on. And so they've been amazing and I wouldn't want to go anywhere else.
That's great. Yeah. We're ready. Well, I think we stalled long enough.
Sweet.
Yeah.
All right. I think we
They
bought
can't tell.
bought
Yeah,
enough
they
time.
can't tell all when we
No,
stall,
not
right?
at
We're so
all.
good at it. So without further ado, we have Andrew Saul on the Zoom. He's with Physicians Mutual, and he is going to talk to you about the product offerings, very exciting offerings that are now available to all agents, independent and captive, with Physicians Mutual. So Andrew, take it away.
Hope we are all doing well. Thank you for having us as part of this. We've got some sheets I was going to put up today. We're going to talk about some of our products. We're going to talk about cross-selling, And I thought it'd be good to throw in some secret spice, talking about some special minds that agents can start looking for to really get off the ground and running. So maybe Jen, can you throw up some of the documents I sent you? I guess as we're doing that, we'll go right into cross-selling. So the purpose for cross-selling, for those who are familiar with Deft Research, bought out through Integrity, they say that for every other policy you have in a house, you drastically increase your retention rate. So if you want to go from keeping 90%, 80% of your clients every year to going up an extra 40, 50%, you can do that by combining policies. So when we're talking Medicare, really Medigap specifically, there's three main policies that we like to attach to plans. Number one, a dental plan, because traditional Medicare is not covering it. Number two, some extended cancer protection. And number three, some life insurance and maybe some GI life for people who want some final expense coverage. Physicians Mutual, we have one of the better dental plans out there for the premium. If you guys seen it, hopefully you have, so you can kind of follow along with me. One of the documents, hopefully we'll be able to get up here, or we can shoot to you an email. It's called a retirement checklist. The way it works is this. You're going to have on one side of the page what currently your client is doing for group insurance, what they're currently doing for dental coverage, cancer coverage, life coverage, and retirement planning. And on the other side, you're going to have what they could expect with Medicare. It's a great document to use because it allows you to have access visually, especially for a visual client, to what they're currently paying and what they could have if they were to move to Medicare. You could use this for MAs, you could use this for Medigap. Either way, it doesn't matter. As long as you're getting the sale, it's going to help increase your cross-sell potential. Just to make a statement real clear so you don't come off as some sleazy salesman, right? The place to sell a dental, cancer, or life policy is at the beginning of an appointment and not at the end. So what I mean by that is this. If you've ever been on an appointment and you get the Medigap sold or you get the MA sold and you come to the end and you bring up, well, we can also add on some extra cancer, so a hip plan, some extra dental coverage, and your clients, they feel like they're being sold to at this point, so they back out. I don't think that's the proper way to engage somebody. The time you sell a cross-sell or the place that you're going to sell that cross-sell is at the beginning of your appointment. So when we're going through this retirement checklist, hopefully you'll have access to. If you don't, I can make sure you get it emailed to you. It's going to ask you what's your current coverage. So I'll run through it with you real quick. So Mr. Mrs. So-and-so, here's my transition into the Medicare thought. Just to make sure you have at least the same, if not better coverage in retirement as you currently have, I want to run through this little checklist for you. Is that okay? They're always going to say that's fine. Perfect. So what are you currently doing for insurance? Do you have a group plan? Yes, we do. Who's your group plan through? Blue Cross Blue Shield. What are you paying for a premium for that? About $250. And is that every other week? Or is that bi-weekly or is that monthly? It's bi-weekly. So you're paying about $500 a month for coverage. That's right. And is that just for you? Yes, that's just for me. Great. Now, with that in mind, we know, Medicare is almost always going to give you better coverage than any group plan out there. And usually for a cheaper, if not the same premium, what that group plan is. And if someone's giving me a quote for $500 for that group plan, I'm rejoicing in my heart because I know we're doing something. Maybe not today, but hopefully today. So, okay, great. And does that group plan have a max out of pocket associated with it or a major deductible? Yeah, I think our max is about $7,500. Awesome. Okay. And now, is dental coverage important to you? I don't care what they're currently doing with dental. I'm just bringing the topic up so we can seal the deal with dental coverage at the end of this conversation. So is dental coverage important to you? Is it important to you to be able to go get your teeth cleaned, have insurance pay for it? If you need to crown, have insurance pay. Yeah, that's pretty important to me. So I'm just checking, yes, that's important. Here's your next phrase. Have you or anyone in your close-knit family ever had a diagnosis of internal cancer? If the answer is yes, most likely you're not going to qualify for an extended cancer protection. If it's in their own personal life in the past 5 or so years, depending on the carrier. If the answer is no for their own diagnosis, almost exclusively, everyone will say yes that someone in their close-knit family has had a diagnosis of internal cancer. So here's your next question to them when you get that yes. Really? Can you kind of tell me about that? So now they'll come in. Well, you know, my mom, she got diagnosed with breast cancer. She got diagnosed with lung cancer. My grandfather, he had developed bone cancer, leukemia. I'm so sorry to hear about that. And then if you have your own personal story, you know, my grandfather, he developed brain cancer. He had the thing for 6 months and then he passed away. Unfortunately, according to the American Cancer Association, right now, 1 out of every 2 men will have a diagnosis of cancer in their life. 1 out of every 2.5 or 2.5 women will have a diagnosis. And if there is a diagnosis in your close-knit family, mom, dad, brother, sister, aunt, uncle, grandma, grandpa, unfortunately, your rate or your chance of having a cancer diagnosis significantly increases. So we should probably talk about some extended cancer protection then. Don't you agree? You see what I'm doing? I'm shaking my head, yeah. Nod my head, yes. Why? Because I'm not coming in there selling cancer insurance. Listen, if you can hear my voice, you're probably an insurance agent, right? How many of you as insurance agents want to buy insurance? Right? You don't like buying insurance. That's not something fun for you. How much less fun for your clients? So you're not selling a HIP plan or a cancer insurance plan. This is extended cancer protection that you're bringing to the table. So yeah, it's probably something we should talk about then, don't you think? Yes. Okay. We'll continue. As long as it's not an MA, we're not trying to cross-sell life because of AHIP, but let's pretend it's a med gap. So we're going in. Now, let me ask you this. If you were to pass away, who would have to foot the bill for your funeral or cremation? Always include them both. Burial, funeral, and cremation. Because if you say just burial, they're going to come back, well, I'm going to be cremated. If you say just cremated, you know, if you've done this for a while, you've heard it all, right? If you say just cremated, they're going to come back, I'm going to be buried. So hit them with both. So unfortunately, you know, we only got to deal with this one time. If you were to pass away today, who would have to foot the bill for your burial or your cremation? Well, I guess my children would. Okay. So then maybe we should talk about some extra burial coverage or cremation coverage, some final expense coverage. Does that sound good to you? Nod my head, yes. Looking for that yes back. Yeah, that sounds good. Awesome. Okay. So now we're going to the Medicare discussion. We're going to make that transition. We're going to go through what I would do, the Choose a Medigap brochure. We're going to go through page 7. We're going to break down the difference in traditional Medicare, A and B, with a Part D drug plan and a Medigap or Medicare Advantage. Whatever side of the page they go on. Listen, if I'm an independent broker, I don't care. I just want them to make an educated decision. And from that educated decision, we can make a sale, right? That's my goal, is to get the sale of that house. So they make their decision. Let's say they choose a Medigap. I'm going to pull out what's called my retirement protection summary. Guys, it looks super simple, and it really is. What the summary looks like is this. You're going to have the word Medicare Supplement wrote at the top, or Medicare Advantage if you're writing an MA. You're going to have a premium next to the MedSup. You're going to have dental, premium next to the dental. Extended cancer protection, premium next to the extended cancer protection. And if we're doing Medigap, we're going to have life on there, premium next to the life. And I'm just going to add them all up right there. Put the numbers. I know the MedSup's $110 for your plan G. I know your dental's $46.75. I know your cancer's $49.13. I know that your extended life coverage is $53 for $10,000 in guaranteed issue life for a 64-year-old with our carrier, or our company, excuse me. So I'm going to add all those numbers up, and here's my presentation to them. All right, yes, Mr. Mrs. So-and-so. So right now you're paying about $500 for your Blue Cross. You know, it's got a $7,500 max out of pocket. Good news. I can get you better coverage without a network, with better dental than you've ever had, more comprehensive dental plan than you've ever had, $10,000 in guaranteed issue whole life insurance, and $10,000 in cancer benefit. And we can do all this for about $250 a month. How does that sound? Sometimes you'll get the feedback, well, I don't know about that cancer plan. I've heard bad things about it. So here's your rebuttal. Okay, so let's talk about it. Let me ask you this. If you were to have a diagnosis of cancer and diagnosis of internal cancer, would you get mad at me if I cut you a check for about 10 grand? Usually they'll laugh. No, I don't think I'd get mad. What if I wrote you another check for $8,000 for a chemotherapy benefit? Would you get mad at me about that? No, I don't think I get mad at you for that either. All right, well, that's how the extended cancer plan works. We're going to cut you a check for an internal cancer diagnosis, up to about $22,000 to $24,000 your first year on the plan, and then it resets every year depending on what kind of diagnosis you have. Now, once again, so for about $250, we can get you all this coverage. It's our bundled package, and I can give it to you for that special price today. How does that sound? Usually you'll get a yeah. And we've just turned a $350 Medigap sale into an $1,200 Medigap dental, cancer, and life sale. And according to Deft Benefits, we just increased your persistency significantly more. Now, when someone calls from the outside, they run into a life insurance agent, and the life insurance agent wants to sell them some life insurance, or they run into another Medicare agent, and the Medicare agent wants to flip them, your agent can say, well, now hold on, I've got all my policies. I've heard this before. My MedSup comes with dental cancer and life coverage. Why? Because they got the bundle. And the bundle is the way you're going to take your income from, $40,000, $50,000 a few years in or first year to $100,000, $150,000, $200,000. We got agents making high 6, low 7 figures because they're doing this bundle and they're doing it consistently and they're building up their renewal base. Thank you guys for having me on here. I appreciate you. And you can reach out to me if you need me.
All right. Welcome back, Andrew. Thank you so much. We are here now with the panel that you have all been waiting for. I know this was the highlight on the agenda, so we're just going to get started. If you have any questions for the panel, any questions at all, throw them in the chat. The team will let me know. They'll say, hey, idiot, look at your phone, and then we'll get moving. So first question, though, I'm going to toss it out here. What do you wish you would have known when you got started? I'm going to toss it to Tanner first, and then we'll probably toss it to Corey. Corey just got started, so what does he wish he would have known 6 months ago?
No.
So, looking back 2 years, I know Toby kind of hit on this earlier when he was talking about leads, is I really wish I would have, got started practicing with some age leads. I would probably say that the biggest struggling point for me as an agent to start with is trying to get on the phone with somebody that may be an age lead and trying to convince them of who I am and what kind of service I could provide. But I really, truly wish I would have pushed hard through that, because that helps with any type of rebuttal, any type of conversation that may come up with somebody. And it really helps you as the agent, I would say, and Corey may be able to add more into this, really helps you practice your pitch and your sales pitch. I think, going through those and being able to hit barriers and hit walls and overcoming those, obstacles really gives you confidence internally that maybe you didn't know you had. And once you're able to do that, now your tone changes, the confidence and the sound changes on the phone. And really that could be everything when it comes to a lead, is just having that confidence and that tone that's a little different. That may be able to help when you're on the phone with a lot of people. It's different in person because they see you, they see, your body movements and body language, but it's really hard to do that over the phone.
I would agree. The confidence is huge for agents, and your clients can hear it. They can hear the confidence in your voice, whether it's over the phone or face to face. They know if what you are saying is genuine and you genuinely believe that you're helping them. I promise you they can see it. So, Corey, did you want to add anything to that?
Yeah, I mean, the confidence is that really big kicker. And one of the spots where right off the bat, I wish I would have done better when I first got into it, was asking for that good referral or that online review. We've gotten to a point now where that is just built into our system. Of course, hey, I don't charge anything for my consultation. The best way that you could pay me back is taking 2 seconds and clicking on this link and leaving us a Google review, or telling friends, family members, strangers with gray hair that you found a great guy to work with.
That's great. Anything you want to add on the startup?
Yeah, when I started as an agent, I wish that I would have taken the time to make a list. They call it the 100 list, and list 100 people that you need to talk to and tell them that you've gone into business. Really focusing on, you think you don't know, but when you start thinking about maybe your parents or your grandparents, their friends, your pastor, neighbors, you start listening to those people. And every time that you talk to them, they say you move that person off the list into whatever bucket they go into, and you add someone back to the list. And so I think that helps a lot with, I don't know who to call initially, so that you don't have to come up with the money right away. And then sending that letter or even handwritten card to those people to tell them you're launching a business, because these people are supportive and they want, even if they don't purchase anything from you, they'll still let you practice, and leaning into that more.
That's huge. That's great. So I'm going to keep rolling here. At what point in the year, we're getting ready to, we're talking about AEP and getting back to the basics, but at what point during the year should you be reaching out to your current client base to talk about upcoming AEP?
I'll get started with that. Really, when I start that game planning is the very 1st of September. And really what I do, naturally agents, you'll know, as you get to be more of a veteran in this industry, your book of business is going to grow. And so that time frame may change for everybody. But this year, I'm really targeting a September the 1st date of truly reaching out to my clients and letting them know that AEP is coming up. If you have any updated medications you need from your formulary from last year, please update this. And I'm using a Pearl this year for that to help gather with that information, because since it's just still me, and now that I have hundreds of clients, it's going to help me be able to gather that data, so I'm not getting manual data back in, and now I'm having to update my CRM. So I'm going to use a Pearl this year to help with that. And I'm really excited to look forward to that. If you want to know what I'm using, feel free to reach out. I have no problem doing that. But I think that's going to help me be able to automate a little bit more for myself, because once October 1st hits is really when I'm starting those reviews. We got to be compliant with some things, and we got to be compliant with the 48-hour rule. But really being able to plan out a little bit of changes this year is going to help with that.
Yeah, we're starting right around that same time, that August time. But it's what we like to do is ramp it up. You're starting off with those emails, and those emails, they're going to be very good for the people that you currently have and outreach. But there is that little bit of insincerity that comes with an email, because you're sending it out to so many people. Following that email up with a personalized letter that you're sending out to everybody. Technology is fantastic. I don't actually have to handwrite letters for letters to be in my handwriting anymore.
Yep.
And I can still send them out, and then following that up as we get closer more towards that late September, maybe even if you haven't heard from people that you need to hear from, hitting them with those personal phone calls and letting them know that you're still there and still in business.
Anything you add to it?
What I send, it's about the same timeline. I make sure that my letters hit the mail by August 25th. I'm just trying to get it there a little sooner than other agents. But what I do add to my letters is that these spots from October 1st to the 15th are initially only offered to my current clients. So that seems to help them get on the books sooner. I tell them, hey, I already know them, so they're a little easier. Obviously, I know who they are. I know kind of what they feel. So definitely making sure that I offer those to them. A lot of times I'm able to knock about 80% of my clients out before October 15th even kicks off. But I completely agree. Like Corey said, you have to follow up. It can't just be an email or a letter and that's it. There's so many programs now. You can even text, send the text, do whatever. And guys, I think it's silly when people say that people don't like to text. I'm like, these are not the eligibles that there were 20 years ago. They're texting. They're on Facebook. They're doing all the things.
It's the only way she tells me happy birthday is by sending me a text.
Aw.
I know. She knows I don't want to talk on the phone.
Okay.
And I think from the get-go, when you're helping your clients, whether it be somebody that you wrote one AEP and you acquired them as a new client, or if they're turning 65 during the year and you acquire them, I think setting the tone from the get-go with them is huge, because let's be honest, between agents and agents, right? If you're doing right by them, whether that be an MAPD or even a prescription drug plan, there shouldn't be too much changes that go on unless like health has changed or medications have changed, or maybe you just have a completely new product that's come into your market. So setting the tone early with them and saying, hey, listen, I'm going to follow up with you during AEP. More than likely, this may be the best plan for you next year, but we'll have that conversation then. And if you're doing right by them, they're probably going to be happy with that plan regardless. So just having that touch basis point, moving on, has helped them know that, hey, I'm here in the long run for you. And really, that's going to help save you time as well, acquiring new business for an AEP.
You mentioned something yesterday when we were all together about a video service that you use. Share that if you don't mind.
Yeah, so we use a service called BombBomb. And really, BombBomb is just, I can start shooting videos that are little 1 minute, 2 minute segments, and I can email blast them to all of our clients. Or I could create, different subgroups within my clients So that's helped me be able to email blast maybe all my prescription drug clients versus all my MAPD clients, because those conversations may be a little bit different come AEP as well. And so being able to use that, they see my face. I know not many people want to see that often, but that's okay. But once a year is okay, right? And so I think that having that touch point gives you a personalized approach. And if you're doing right by your clients like that, and you touch them, they should not be moving on to another agent. They should be a client for life.
Great.
Or when somebody comes in the back door, they're at least going to call you first and be like, hey, this has come up, and you can have that conversation for them.
That's wonderful. All right. A question from the audience here. If you do have any questions for the panel, make sure you're getting those in chat. The team is getting them to me. During AEP, with all the different types of business you do, how do you measure or track your wins and losses?
Yeah, that's an excellent question. So for me personally, my very first year in the business, I got started up right before AEP went into effect. So I was really just focusing on learning about MedSups, Medicare Advantage, all that good stuff. This last year's AEP, what was very important to me was I looked at all the clients that I had attained throughout the year and the AEP previously, and I said, okay, so I have all of these people that I've put on Medicare supplements and prescription drug plans, but I wasn't able to get that ancillary dental, vision, or hearing policy attached. I have all these people that I've put on the Medicare Advantage policies, but I didn't really hard sell that hospital indemnity last time. So just as important as prospecting and finding those new people to get onto your books during open enrollment, a lot of those ancillary benefits and as Kim says, mining your own book and finding the opportunities that you've already walked by, those are huge wins that we celebrate during open enrollment season.
Did you steal the mining thing from me?
No.
You've been using that for a while.
I've been using it for a while. I think you stole it from me.
That's possible.
I'm sure we stole it from someone.
We'll check
There
the
are
trademark.
no new ideas in Medicare. It's recycled using as long as you give the people credit. So, but on that topic, and all of the agents know because they probably roll their eyes when I say it, but taking the time to track your clients from the beginning, it's really easy to say, hey, I'm getting started. I don't need it. I just have 5 clients. I just have 10 clients. I have 20 clients. But I know that both of these gentlemen here can speak to, especially Tanner, that they maybe took that route at first. That wasn't where they chose to spend their money. And having a system, a CRM system, you can get them for very cheap. There are systems out there that are $25 or less a month. There are systems out there that include commissions tracking, different things that are around 100, 150. There's the gamut on it. But tracking the clients, and the reason I pull that back in is because then you can pull them with different lists, and then your wins and losses, you know which clients you talk to, which ones are in which funnel. It's a good way to track. And honestly, if you're wanting to build something bigger than just yourself, you're going to want to be able to track how your agents under you are doing, right? Like if you're handing them 50 clients, you want to know how they're doing with those 50 clients. So
I think that sometimes you don't realize how quickly you're growing until you need something like that.
Yeah.
And so don't do what I did and having to scramble and put spreadsheets together to get into your CRM from the get-go. And I have no problem saying that, right? Because if you're growing that quickly, it means you're probably doing something right by your clients. And that's a good thing. You're blessed that way. But start early on, and it's not, like Kim said, it's not that big of an expense, because if you're able to practice your everyday practices with your CRM tool with that, once you start to get so big that now you really need it, you already have those processes in place. So now you're not having to worry about working the back end of that and trying to learn those steps. So
yeah,
Kim's right. She hears that a lot.
Nah, you guys don't like to be that nice. It's a shameless plug too, but if you're working with Magellan, you don't have to pay for all those other systems. So really, that's your only system expense that I could really think of, because there's other systems available right on the marketing side, a lot of things covered. So it's really about figuring out your business plan and what makes sense. And we do that with you. And Tanner does that. Corey, you've helped people with business plans. So
yeah. So on the outside service, so I get that question a lot of what CRM should I use? And I recommend agent CRM to just about everybody. Some people have a lot of different versions, but agent CRM has a lot of the things that we've already talked about. That has the texting, the email, all that stuff built in to make those touch points, those reach outs a lot easier. It's
not the cheapest on the market, but it is one of the best built out. It has a lot of automations that can really help you grow your business and scale from there.
If we're making recommendations, I would say agency block.
Oh,
And
here we go.
so
Uh-oh.
my reason for that is they may be competitive on the CRM side, but to date, and having talked to some of the other, movers and shakers in the field, like Justin Brock and I have had a conversation before, commissions tracking is probably the biggest beast, right? Like it's the biggest pain. And to my knowledge, agency block is the only one that's really cracked the code to allow us to get that built. And so it's kind of the coupling. So you do spend a little more money because you end up spending, I don't know, around $125, $150, but you're getting commissions and the agency system. So that would be my suggestion. If you have questions about it, we can send you a link on it.
Screw it, man. I would take the link.
Yes, with that question, I know they kind of asked a little bit about, I think we got into a little bit of like what is a win, but in terms of how do we track wins and how do we keep organized on who all we've talked to or what we've done within the agency block system, what we do is we have a pipeline built. And anytime we put somebody on our books, we put them into the active book of business pipeline. Whenever we send them into an email, they move into that next step. Whenever we send them a mailer, they move into that next step. Whenever they schedule a meeting, we move into that next step. And then they move into the final one of 3 columns. Did we meet with them and change their plan? Did we meet with them and not change their plan? Did we not meet with them and did they stay on our book? Or did we not meet with them and did they go somewhere else?
Yeah.
So that is one great thing about agency block and their comms tracking is that if they move their plan anywhere else, you know it because they no longer show up. You're not getting paid for them anymore.
Smart. And so along those same lines, so you sign clients on, what types of appreciation items or celebratory items are you following up with after they sign on? This one actually mentions cake or pie. I'm not sure if that's a separate question of what we prefer, but
it's probably a lot of agents do around Thanksgiving time. They do the pie pickup, right? So they'll have, hey, do you want an apple pie or a pumpkin pie? Like I've seen a lot of appreciation events like that.
Well, hey, we love branding at Market. Every person that comes into our office when they leave, they either get a little pill bottle that's got our logos on it or little chapsticks. Just little tiny things like that because we don't want that to be the big selling point, but they love them. They're not super taxing on the wallet, but little things like that do make a difference in the client's life.
Yeah, anybody that signs up as a client for us, we always send them a welcome to Guardian video that's branded from Gary, our owner, and so they love that personal touch feel of everything. But also we're really big in our market on charity giving. And so we have a lot of different partnerships, whether it be a food bank or around Christmas, we do the Forgotten Child Fund where people can bring in sweaters, toys, monetary donations. But I think really having that, communication with our clients is huge because they want to be vested. They want to invest in something like that because they feel like they're doing something that's huge for our community. But it's through us as well, too. So there's that personal touch. They know they can come directly into our office and drop things off. And having those different type of community events through charities, they feel like they have this sense of pride and give back into the community, too, and help.
So there's a lot of things in this medical market, or the entire market, that change every single year. How do you stay on top of the changes?
You guys are both looking at me.
We're all looking at you because we know.
I would really truly say that, understanding that change is inevitable. It's going to be inevitable no matter what, right? Since I've been in the business, there's been multiple changes that have happened already. And so just understanding that that's going to happen and you're just going to have to get a little better every single day with it or do a little bit more studying on what you need to do with your processes. Don't let that overwhelm you. A lot of times we can see as agents, when things change, we get overwhelmed with it. But keep this in mind. If you feel that way, I guarantee you that 90% of other agents nationally are feeling that way as well. So if you can channel that internally yourself, get better just a little bit every single day from that, you've now separated yourself from the pack. And now that's the way to grow as an agent, in my opinion.
Yeah, well, we see a lot of stuff come out every year around the AHIP where, so especially if you're in any Medicare Facebook groups or whatnot, people, how quickly did you pass the AHIP? Like, did you paying attention to that, just for actually paying attention to it and taking it does make a difference. Your FMO, if you have an FMO that's not Magellan, I don't know what they're like. Magellan does a great job on keeping us up to date with any changes that do come to the Medicare system when they come. And that's also a great technique to use whenever we're talking to clients on that first meeting. Hey guys, listen, this Medicare thing, it is constantly changing. Some of the changes that we've seen, that is why it is so important for you to come in every single year during open enrollment. And it's going to keep those renewals coming and drive home the importance to a client.
And that could be the first touch point of setting that meeting up for AEP next year.
Absolutely.
And it's a collaboration, right? So there's 3 things that I would suggest that all agents do, and IMOs really should be doing it as well. I mean, the first is collaboration, right? Like those Facebook groups, there are Facebook groups out there. They are based on education. They're agents from all different IMOs. There are captive agents and there are independent agents and there are principals, and just like everyone is out there. And truly the idea behind it is to share and get information, right? And so as soon as someone sees a change, they are posting it and they're sharing it, and we're helping each other from that respect. So if you're not in those groups, you need to be in those groups. And all you really have to do is Google Medicare group on Facebook, and there's probably several dozen.
There's no limit.
There's no limit on the number of groups. And the only reason I'm not going to drop any names is because I belong to several, and they are great groups. No, not at all. The other thing though that you can do for your own independence is go out on Google, and there's a way, and we can do a video and show you, but you can actually flag words. So that when those words come out, it will forward you an email with the link to that article. So I have the word Medicare flagged. I have the word CMS flagged. Yes, I get a lot of stuff. I'm like, meh, but I get a lot of really good things. So for example, I had something in Pennsylvania that had changed, which is really interesting, but I was then able to shoot that email to all of our agents in Pennsylvania. And that's an extra ad for that. They're like, oh, my IMO knows what's going on in my state, and they're halfway across the country.
And you also host a bi-weekly training for all of your agents where you bring those things to them as well, don't you?
We do. And that's where I partner with a lot of the other heads of the different IMOs. And so that's where we all work together and we share with each other, and we're all telling our agents about it. And so we actually, both of you this year went to MedicareCon. And when it came up for all the CMS changes, there were a lot of deer in the headlights. And these two are both like, oh yeah, we know about that. I'm like, oh, I'm so proud of but no, that's really condescending. I'm sorry, guys. But it's, yes, share and learn.
No, it was a good feeling. It just made me so confident in my FMO.
So what challenges do you typically face? Let's say someone's new, this is coming up on their first AEP. You're coming up on your second one now. What challenge, third one, okay, third AEP. So what challenges does AEP bring for newer agents that you could give some tips on?
I would probably say the unexpected. I think going into your first AEP, you don't understand truly what to expect to go through. It's all going to be dependent on your book of business probably too in that first year, and how many reviews you may have versus how do I acquire new business. But Kim touched on this a little bit too. Maybe in that first year, people don't realize that you're in the Medicare planning space, that you help people with Medicare plans too. And so getting your name out there anyway, maybe grassroots, going into doctor's offices, dental provider offices, any way you can do some grassroots marketing to let people know that you're out there and you're providing a service that maybe they've never seen before, or they don't have that personal touch. I think that's huge to get your name out there. Because I know for me personally, it wasn't until that second AEP when I really started to, lean back and be like, oh, wow, okay, I'm getting phone calls now from people that said, hey, so-and-so said you do this and that you help with this, right? And a few of those people, I had no idea who they were, with those referrals.
Oh, thank you.
They're not even clients of mine, right? But they know that you're in the Medicare space. They may already have a Medicare plan they're okay with, but hey, this guy does it and he can help you with it.
The key to that, though, is if you're going to get in with the doctor's offices, if you're going to get in with those providers and those contacts, no one likes being sold, and that includes doctor's offices, right? So if you're going to go in and do that, you have to go in and do it from a very selfless. It's, again, Jen talked about earlier, the law of reciprocity. And go in and just educate them. Like, here's what's going on. Here are the different ads that you're seeing. Here's what it means for your clients. Here's this. If you have questions, I know your clients have questions. You can use this. You don't even have to tell them, oh, send them to me, because they will just want to do it, right? Like there are YouTube videos out there about that and how to do, but don't do something with that quid pro quo. If you like, you have to just give that information and trust that they're going to want to send their clients to you.
Anything else that you guys want to talk about? I have one comment for newer. I think what most people don't understand is that they need to work doubly hard during AEP. These are not short days that you should expect. You should want to be successful and work these longer days. I think I talk to a lot of agents who are newer, and what they don't understand is how to put that time on their calendar, to schedule that out, and to understand that those 6 weeks, that is the most important 6 weeks that you're going to go through each year. So that's
Medicare tax season.
Yes,
Absolutely.
Now, what do you think the biggest lesson is outside of AEP time that you could share?
Okay, well, I'll go first. I think there is still a huge misnomer that AEP is the only time that there are sales in Medicare. People think, oh, they're turning 65 and they're aging and I can help them, but now I can't help them until the annual election period. And there's really 3 major ways of helping people, but you can help people all year long, right? If you have somebody on a supplement, right, and depending on their health, you may be able to save them money and get them onto a different supplement. We know that we have the annual election period. There's also the open enrollment period, right? And we hear those names used wrong sometimes, because January to March is when you have to protect your book, if you will, and make sure your clients are good, make sure you work that appropriately. But then again, mining your book. What are those clients? How can you check in? What do they need? And honestly, just over those check-ins and the education, I know, Corey, you guys are getting ready to do a brand new seminar that we created with you guys that really talks through the healthcare landscape, right? And those health to wealth kind of clients, how do we look at that? And maybe that isn't a Medicare sale, but it's a short-term care product or a long-term care product, a life product. So there are other ways to work this book all year long.
Yeah, I think the turning 65 market is something we focus on big time. And, understanding your numbers, we talked about it earlier, is huge. There are more people turning 65 every single year until 2030, y'all. In this country, the numbers don't lie. Every year from now on, there are more people turning 65 every single year. So let's use common logic, right? There's going to be more demand for people turning 65 every single year over the next 7 years. That means there's going to be more people to help every single day that's outside the AEP season that you've seen from the previous year.
Yes.
So if you put yourself out there as that expert, somebody that helps transition from their workforce and their retirement into their Medicare plan, and you're going to get referrals galore. And really, it's going to be a full-on 12-month type of full-time job that you're going to be able to build that business quicker with it.
Yeah, I think a lot of agents just try to work AEP to AEP. And I think they forget that time, that 9 months in between or so, is really the time where you can help foster a lot of relationships. And you can build those for future. It's also a great time to find networks, right? Just because it's not AEP does not mean there is not a lot of business out there to be had, as long as you're willing to continue to put in the work. Let's see. If you have any questions, I'm going off mine now. You guys are drying up on me. I need about 5 more questions from the audience right now. Get in the chat. If you've got anything that you've been wondering about, now's your chance to ask it. So let's see. I did that one. What advice would you give to an agent that is struggling, who's hit that slump time, right? That every agent goes through mentally. You get in your head. What advice do you give?
Yeah, well, two tailored piece of advice. Number one, you do still need to invest in yourself at this point. If you are struggling, there are reasons why you are struggling. Are you struggling? Is that coming from your marketing? Is it coming from you sitting down with people and not being able to get a second meeting or be able to enroll them? How comfortable are you with your product knowledge? That's a very big one. To the point where, if you ask me co-payments on different Advantage plans, I could tell you off the top of my head. Knowing your product inside and out, refining your skills so that when things do pick up, you're there and you're prepared for it. I mean, we notice different market trends. One thing that we've been very keen on recently is whenever we do workshops, we've been doing most of it digital advertising because we hadn't seen mailer doing very good. Well, our past 3 workshops haven't been very good. So now we're going to make that switch back. We're going to go back from digital back to mailer. There is no time in the Medicare industry to get comfortable. If you are comfortable, you're doing something wrong and you're missing out on something.
Agreed.
I believe that, as an agent that's struggling, understanding that we've all been there and like we all still go through some struggles all the time. And so even though you may see somebody up here that you're like, man, I want to get to that level, everybody's struggling. I've struggled so many times in this space and learning things. And so knowing that and knowing that there's other people that may be going through the same struggles as yourself is huge because you may not know that many people in the market or in the industry that are agents, but reaching out to a resource like Kim, she works nationally with a lot of agents. She may know an agent that she can link you up with to be able to talk through those struggles because you may have done the same exact type of thing that you both have been struggling with. And so helping, agents helping other agents is huge in this space because we've all been through some type of struggles. And, I know that I've talked to a couple of agents that you've had that linked me up. And, just being able to talk and understand that we've all been there and any way we can help, we're going to help. But Corey hit the nail on the head too. You got to understand what is it exactly that you're struggling with? Is it marketing? Is it leads? Is it, your sales pitch? What in the process are you struggling with? Because you won't be able to help yourself unless you're able to identify that first.
You definitely have to have that ownership, right? And you have to check your ego at the door. Like you have to be okay with being like, I don't have it all together. What is it that I need to do? How do I do better? To have a good mentor or some kind of coach who can then look at it and look at your processes, give you feedback. You're okay with that feedback and kind of figuring out how to move it forward, right? Like you said, we do biweekly calls. We call it coaching with K6, but really I bring something every 2 weeks based on what I'm hearing the agents constantly question or have frustrations with or trouble with, or something that's going on in the field or a new product. And we only spend about 15 to 20 minutes on that. And sometimes we don't even cover that because we'll get in there and I'll have some agents who are like, hey, just real quick. And the whole hour will turn into that. And to me, that's priceless, right? I would rather send an email with whatever my update was and give the agents that time. And we call it just our roundtable. They ask questions. But what I love about that is it has also given them a relationship with each other. So both of these guys can tell you they have agents from across the country that they probably never would meet otherwise, that they have their emails, their cell phone number, all that good stuff. And we have a Slack channel, right? So if they have a question on the fly, they're sitting at a house for a client and maybe the Magellan team isn't available on the phone right that second. Not only do they have the Magellan team on Slack, they have the hundreds of Magellan agents on that Slack as well. So
I can't tell you how many times I've answered a question during a Chiefs game.
These agent connections, they really are important. I mean, me and Tanner just had last week, I had a client move from Kansas City to Tennessee.
Yeah.
And I know enough about my Kansas plans. I know nothing about Tennessee and they're Medicare Advantage clients. Hey, Tanner, tell me a little bit about these plans that are going on down there in Tennessee. Stuff that I never would have been able to. I wouldn't have had the time to sit there and read through all these plans just for that one client that moved, but he made it easy.
That's so funny too, because when you just knowing both those states, you would probably not have steered the client where they wanted to go because the ideal carrier normally in Tennessee is one of your less ideal in Kansas, right? So, right, and you never would have looked because yes, absolutely, and it's because of the state difference, right? So that's funny that you guys said that.
The cool thing about it too is that knowing what his clients wanted out of their plan, and knowing that they had some flexibility, was able to just say, hey, Corey, these are going to be the 2 carriers that you could probably go with and get away with, that you don't have to worry about the one that may be the juggernaut in Tennessee, right? And so it worked out perfectly for everybody because he keeps the same clients, and now they know he may be an expert in Tennessee too with it all. And so just don't come too close to Chattanooga, buddy. Just kidding.
Well, hey, even when I was getting started, I mean, there would be times that I have a client that's moving to a state that I'm not licensed in. I don't want to have to take the time to go through a license, but I've built this relationship with these people, and they actually were some people that had some money with our finance guys, and I want to make sure that I steer them in a positive direction. And having an agent that I know I can hand them off to and they're going to be taken care of. Of course, I'd like to keep them on my book. But I know they're going to a good space.
And they're not going to try to take that client from you. You've got that relationship with Tanner, right? He's going to take care of the Medicare side, and you guys have the relationship.
I think as the agent, going through that experience with your clients and going and seeing another market, like we have an office in Jacksonville, Florida as well. And so me learning about the Jacksonville market versus the Chattanooga and the Tennessee market, completely different. And so it's eye-opening from the agent experience, because now you can really understand and channel what needs to happen for this client, and understanding that, some of these major call centers out there, they may not know the best plans, and they're plugging in zip codes for the very first time. There's some good call centers out there. Let's not say they're all bad, right? But a lot of main ones that may be out there on TV too much, you can now understand that, hey, listen, I'm trying to do what's best for you. And these people are plugging in zip codes for the first time. They may not know what plans are important. So they're just going to throw out the top 3 or 4 plans that they know about, right?
Yeah. So going back to the slump, when you're struggling, understanding that your problem is not new. There are agents, I promise you, there are thousands of agents that have been through the exact same thing. So what I tell everybody is to get back to knowing your numbers, dig into your numbers, figure out where the shortfall is. So you mentioned, is it in your close? Is it in your pitch? Knowing how you're progressing clients through is where you're going to find where you need to focus. So if you're not getting enough clients in, it's your leads. If you're not getting enough clients from appointment 1 to appointment 2, it's your pitch. If you're not getting them to your close, right? Then that's the point.
And that all comes down to organization. At the end of the day, that's what we see a lot. And I know that not everyone is as organized, but if you don't know your numbers, if you don't have that organization, it's a lot harder to track it down later.
Yeah. So that brings us in one tip that you would do daily between now and AEP.
The one tip I would do is time block every single day, whether that's 30 minutes or an hour, however you feel like, and truly come up with a game plan for how closely towards AEP do you want to get going with your planning process and sending things out to clients. What you want to target out of your AEP. What do you want to get out of that? Because if you're acquiring new business, I use the term my first year, like as a kid, the hungry hippos game, where you're just trying to gobble up everything. You can try that, but if you're all over the place, you may not be able to scale quicker and gather more business than if you were to find one niche or 2 niches and really target on that and really be the expert in that field to go at. So I think being able to time block just to gather your own thoughts daily is something that's huge, because you don't realize just 30 minutes a day or even just an hour a day. And let's just say it's, during the weekdays, don't worry about your weekends. Let's just say Monday through Thursday, 4 days a week, right? Right there, you're putting in over 35 to 40 hours still now before AEP that you're being able to come up with these strategies. That's a lot of time to be able to come up with these ideas.
Yeah, well, with the time blocking, that's exactly where I was going to go. It makes a huge difference to at the very end of my day, every single day, the last half hour of my day is time blocked that I'm in my CRM. And I am identifying what type of policies I need to be more active in pursuing, how many current clients I'm trying to juggle at once, and then what kind of processes we have getting ready for our marketing that's starting up. Every single year it sneaks up. Even though we're talking about it today, it's still going to sneak up on you. So making sure that you are prepared, that when you want those things going out. I like what you said, August 25th.
August 25th.
August 25th. She knows the exact date that she wants everything done by, making sure everything is prepared so that you can move.
Hey, August 25th is the most important and best day of my life. That was the day my daughter was born. So it's a great day.
It's a great day.
Good day to always
Easy to
remember that.
Good choice, Kim.
Thank
Yes,
you, Kim.
you're welcome. I would say the one thing that you should definitely, simple to do, but that you should do every day, I'm going to tell on myself, I'm going to regret this. So the last 30 minutes of my business day is not available for scheduling, ever. It's just not there. Doesn't mean that it doesn't get scheduled. Doesn't mean that I won't put an agent in that spot. It just means it's not just out there, right? So like I have my Calendly link, it's never open. And so before I leave, and the team here can speak to it, they laugh at me. Before I leave, it doesn't matter if it means it's 7 o'clock at night or it's 4:30 in the afternoon. I take the time to figure out what is the one single most important thing that I need to do tomorrow. Maybe that's taking care of a client. Maybe that's getting something for an agent. Maybe that's a certification, whatever that most important thing is. And I write it on a sticky note and I stick it on my computer monitor. When I come back the next day, it's right there at the front. Life happens. Agents happen. That's what I say. And so I don't always get to it right away, but I'm not going home until that sticky note's done or addressed. And then I'm going to get a new sticky note. And it is a physical sticky note. And that's just me. I'm old school in that respect. But if you pick one thing that is far more manageable, and I think if it's your first AEP or you don't have a good plan in AEP, then pick something that has to do with AEP and just do that every day.
Yeah, it's great.
Getting into time blocking is huge. I'm not, but there is nothing on my calendar. If it's on my calendar, then I will do it. So I put every single thing in my calendar. So I know exactly what I'm coming in tomorrow, looking to accomplish that next day. So every day, at the end of the day, I review my calendar right before I go to bed. So I am terrible about constantly being on my phone. So everything that I do is set up for the next day. So,
and just a plug again for Magellan, who truly showed me in this business that time blocking is essential and key? Kim Sixkiller. She's the first person to sit down and truly show me how to do that in this industry. And when that happened, it changed my whole mindset on what can be accomplished too.
Well, when you get started at very first, time blocking's hard
Yeah.
because your calendar's not full all the time.
You're like, let's get to it.
But by year 2, it happens and your calendar gets that full. And that's when that time blocking really starts to make a big difference. And it's building those positive habits early on. Something about old dogs and new tricks. You got to start stuff early.
Yep.
And it's a lot easier to maintain that.
Well, I think that's the thing. All of this stuff that I think we're talking about comes back to your organization and your habits, right? And so that's where we talked about you have to get better yourself to pick whoever that is that you want to follow, but you need to improve yourself and your skills, right? So there's a lot of different positive figures that you can follow. You've got the Simon Sinek's out there and the different people that you can follow and say, okay, what are the things that resonate with me so that I can be better, I can do better, that kind of thing. But as you're taught, what I like that you said about AEP and everyone should do, and if you haven't done it yet, you need to do it like today. Decide what you want to do for AEP. Do you want to sell 100 policies? Great. Do you want to sell 500? I don't know what your business looks like, right? So those models can look completely different. First AEP, I have agents that are like, man, I want 20 MAPDs. Great. Back into it. How do we get you there, right? Like you said, it's raw numbers data. And then Pete Fournier has tons of great videos about backing into the numbers because they don't lie, right? Like if I want to do 100 and I know that there are this many days in AEP, then I have to sell at least this many a month. I have to sell this many a week. Maybe it's per day. And those numbers change and you check it weekly or you check it bi-weekly and say, okay, where am I at to hit your goals? Because if you don't educate yourself on when your goals are at, it's just like a sports team or anything else. If you don't know where your weakness is, you can't get better. So figuring that out and then building an AEP business plan. Helped an agent in Texas who for the first time wanted to go to a carrier and get money. He's done great. He's wrapping into his second year. And I think he sold about 50 MA plans in the first half of the year, where he started right before AEP last year. He had only sold like 5 or 6, right? So his trajectory is huge. And so he's like, I don't have enough yet. And I'm like, you absolutely do. You write that in a plan and say, hey guys, I started this date. This is where I was at. Here's where I'm at. I want to do X with your company. And this is how I want to do X. And you build that business plan out. And this is what I want to do. This is how I'm going to get there. This is what it's going to cost me. Can I have some money?
please.
Worst case, they say no.
Right.
But you got a plan.
Carrier money is the best money.
It is the best money, absolutely.
So, all right. So that does it for all of our fan questions. Unless you've got a last minute one coming through, we're going to get wrapped up. Anything else from the team back here? All right. Kim, you're going to close us out.
We're going to close it out. All right. Well, thank you guys all for coming today. We hope that you found at least a nugget or two of some great information from our AEP Readiness Training. Hopefully you have some interest in Magellan Healthcare and all that we bring to the table. Please go out to our website, partnerwithmhc.com. You can also give us a call, or you can email us at magellanhealth@magellanfinancial.com. Regardless of how you choose to reach out, we absolutely look forward to talking to you, seeing how we can help you. And if not, we just hope that you have a great AEP, and remember that you are not alone out there. Take the time, even if you get into the free virtual room, get into the room, take your training into your own hands and go kill it. Thanks, everybody.